Recording in progress.
All right. Good evening and welcome to the April 27th, 2026 Tualatin City Council meeting. I'll go ahead and call the meeting to order. First item on our agenda tonight is a Pledge of Allegiance led by Councilor Gonzalez. All right, that brings us to announcements, and our first announcement tonight is Mental Health Awareness Month proclamation, and we have Gary from NAMI Outreach and Development from Clackamas County. Welcome, Gary.
Thank you, I appreciate that.
Sure.
That was a really quick call-out.
There you go.
There's a button, okay. Well, and thank you very much for inviting us today. This, as you probably know, is Mental Health Awareness Month. And we're here to tell you a little bit about what we're doing as NAMI Clackamas. I presume you're all familiar with NAMI Clackamas because in front of you, you have a bag which has things in it. Number one of these. This is everything you ever wanted to know about NAMI Clackamas. Inside, there's a crisis communication card, which is things to say and places you can refer people to if you run into someone in crisis. Also inside is our special theater night flyer. We have a very special theater night with Clackamas Repertory Theater. That's a fundraiser for us. And on the back of it is a listing of a little bit about what you're supporting, which are some of our support groups. And last but not least, you also have in there a genuine NAMI Clackamas stress ball. Now that guy is guaranteed to remove all stress and anxiety in 30 minutes or less so you get your money back. So keep that in mind. So I'm going to run you real quickly through the basics about NAMI so you know what we're up to and what we're doing. So first question I have, though, is someone want to answer or throw out an answer of the average time between the time that someone suspects they might have a mental health issue and the time that they actually go and seek help? What do you think it is? Years? Okay, how many? 5 years? Okay. Well, you're not really close. It's 11 years. Okay, now we know that that's not access, even though it's difficult. We know that's not cost, even though it's costly. What we know is that it's stigma, first and foremost. And how do we take care of that? We change the conversation. We talk about it. Okay, we bring it up. We start the conversation, especially if it's appropriate. We ask the question, are you okay if we find someone that we think is in crisis or is having some difficulty? And we also want to change our language. Around referring to people as their disease, that's not what we do. They're not schizophrenic or bipolar. They have that disorder. Sooner we can separate people from their disease, the better we're able to participate in their recovery. Okay? So other language around suicide. People don't commit suicide, they die by suicide. You commit crimes, you commit sins, you get committed. It's, again, a very judgmental word. And what that does is it changes the perception. It allows people to seek help, and we know that seeking help, sharing stories is what really saves lives, because that's what we're about. And we're really looking to stop the stigma and really allow people to seek help. Maybe get that 11 years down to 11 months, 11 weeks, who knows, maybe even 11 days. So what's a NAMI? We have 600 affiliates around the country. That means those blue and green don't mean anything, no political affiliation, no nothing. Okay, they're just there to differentiate the states. But there are 600 affiliates. Every one of them has access to the same programming. We know that peer support changes lives. We've been at this since '78, evidenced by the fashion statement in that picture. Those are all wearing tie-dye T-shirts, if you notice. Okay. Some success stories. My favorite is that top one, which is that we brought them out of a foggy, depressed existence and improved the quality of their life. That's our mission statement. Okay, so what do? We have classes, a peer-to-peer class for people with mental health issues and a family-to-family class for everybody else. Those are both 8-week classes. They're mostly they're both online and in person. And then our basics is a 6-week class for family members, caregivers, parents of younger children. Because we know that younger children have developmental issues that may be either masking or confused with a mental health issue. So you kind of want to know how to tell the difference. There's no absolutes. Also some ways to advocate for that youngster, because we know that they don't have the language. They just don't have the words, and the system is still not set up to meet their needs. So that's what Basics is about. Those are the 3 classes we offer on a quarterly basis. We also have regular support groups, 3 peer support groups for people with mental health issues every week. We have 2 family support groups, 1 weekly and 1 monthly. We have a couple of family book clubs, LGBTQIA2S plus support group, women-only support group, an Art with Heart art therapy group, Gather for Games, which is a gaming group online. So we do a variety of different outreach like that, support groups. And we also have a suicide bereavement group that we host in our office and a Compassionate Friends for people who have lost a child. We also have support for adults in custody in jail. We have 3 mental health classes a week for cohorts of 10 adults in custody, a support group for both men and women, and a post-release support group that we just started. That's really to serve the needs of the adults in custody, because we know that jails have become the new housing for people in a mental health crisis, and yet they have no support services whatsoever in the jail. So we're fortunate enough to have people from the jail behind it and the former jail commander on our board of directors. So that helps a lot. We also have peer support specialists. We have 3 on staff. They provide one-on-one peer support and services. They'll connect you with all kinds of community resources, and they'll be there to help you navigate your way through them. The best part about all of this, community presentations, by the way, sorry, I got a slide ahead of myself. Community presentations is something else that we do, like this, but we also do longer ones. Mental Health Matters, In Our Own Voice, Ending the Silence goes into middle and high schools throughout the Clackamas County School Districts. And then we have Question, Persuade, and Refer, which is a great crisis intervention tool. That number there is a number of free presentations that we gave last year alone. Okay? I probably gave about 60 of them myself. So, the best part, no diagnosis, no referral, no insurance, no cost. Everything I just described to you is absolutely of no cost to anybody in need. Right? So all you need is a need, which is the world's worst business model, you understand. Okay? Which is why we do things like fundraising. We have a comedy night in March. We do a NAMI Walks coming up. See, I have my official NAMI Walks hat on. I'm not wearing this just to be cool. You know, I got my NAMI Walks hat. NAMI Walks is coming up in May, on May 16th at Peninsula Park. We have our Party with a Purpose Gala, which is a dinner auction in September, and then our Champion Circle of monthly donors. And then one of the things that you have a flyer for is our theater night, Laughter on the 23rd floor with Clackamas Repertory Theater. Tickets are $25 early bird, $30 after, I think it is May 30th. Okay, but all the funds, thanks to Clackamas Rep, all the funds, not a dollar, not a proceeds, but all of it goes to NAMI. Okay? Same thing is true of our Stumptown, which is coming up in December. We're not sure of the date, but we believe that's going to be for Annie at Stumptown Stages downtown. So those are the things that we do. We also use volunteers. We love any of our volunteers that are willing to come forward with lived experience to either teach classes, facilitate support groups, or just help us in a variety of different ways. So we've just got it. We just inherited what we're calling the West Wing. It's another little office that's just a little west of our current office in the same complex. And so we're looking for people to help us clean up and fix up and get that thing ready for habitation. So that's one of the volunteer opportunities. That's really it. Unless you've got any questions, that's my presentation. We can get right to the proclamation. That's also my little therapy dog over there. I thought I'd bring him along just for comic relief.
All right. Any questions for Gary? Councilor Brooks?
Is that your dog?
That's my dog, yes.
And what's your dog's name?
My dog's name is Carlin,
Carlin. Oh, I can see that.
named after,
George?
oh, you got it. That's
knew
right.
it.
Because he makes us laugh so much.
Can you, do you know how many, when we're talking about stigma, how many people suffer from mental health issues?
Well, 1 in 5 people are going to experience a mental health issue in any given day, any given month, any given year.
Yeah.
So in their lifetime. So it's basically 1 in 5 or 20%. And, you know, we find that there's a lot of comorbidity, a lot of coexisting conditions. You know, so people that are suffering from substance misuse, they typically will, 80% will have a mental health issue. The vice versa is true also. So many people with mental health issues have substance misuse issues.
Yeah, we just found out too that our firefighters and police officers are pre-diagnosed or pre-accepted for PTSD diagnosis. So I just think that the look of what mental health is, and I really appreciate your discussion of not calling people their diagnosis, just like you wouldn't say, that guy's high blood pressure.
That's right.
Thank you.
You're welcome. And you know, the thing is that it's much more likely that you'll recover from a mental health issue than it is from cancer, diabetes, or heart disease. It's just that it's a process with mental health, not necessarily an outcome.
Yeah.
Another question?
Councilperson Pratt.
Oh, I'm just wondering if the kids and younger people, if there's a little less stigma on having a mental health issue, or if it's still a big problem.
Well, the answer to that is yes. It is more open. They are more open about it. There's more discussions around it, but it's still a big challenge, and there's still a lot of stigma around it. You know, we have NAMI on campus clubs that we've tried to start, for an example, in high schools, and we've had a lot of pushback. Not necessarily complaints or arguments, but, you know, just a lot of apathy. So yeah, it's a challenge, but it is something that is being discussed a lot more. And we're getting, when we do our Ending the Silence programs in the high school classes, we're getting a lot more good questions, especially specifically related to their situation.
Okay, with
There's
that-
hope.
Yeah, hopefully, yeah. Council Brooks will do the proclamation.
Thanks. Oops. Okay. City of Tualatin proclamation, whereas mental health is part of everyone's overall health and well-being, and mental illnesses are prevalent in our county, state, and nation, with 1 in 5 adults experiencing a mental health issue every year. And whereas stigma and the resulting discrimination is a primary obstacle to early identification and effective treatment of individuals with mental illness and their ability to recover to lead full, productive lives. And whereas approximately half of chronic mental illness begins by the age of 14, and suicide is the second leading cause of death of individuals aged 10 to 14 and 25 to 34. And whereas long delays averaging 11 years occur between the time symptoms first appear and when individuals get help, and it is therefore essential to cure the stigma and discrimination that is the primary cause for those delays. And whereas every citizen and community can make a difference in helping cure the stigma and discrimination that for too long has surrounded mental illness and discouraged people from getting help. And whereas public education and civic engagement improves the lives of individuals and families affected by mental illness, now therefore be it proclaimed by the City Council of the City of Tualatin, Oregon, that Tualatin recognizes May 2026 as Mental Health Awareness Month in the City of Tualatin to increase public understanding of the importance of mental health, to promote identification and timely treatment of mental illnesses, and to cure the resulting stigma and discrimination. Introduced and adopted this 27th day of April 2026. Thank you very much for your work.
Thank you. We appreciate
It's
it.
a great organization.
Yeah, Nikki, go ahead and present it. Oh, do a picture. Yep.
Yeah, I don't know what the lighting's the best.
All right, thank you, Gary.
Thank you.
We're going to do some agenda maintenance here. We're going to give the members of LEAP a few more minutes to get here. Hopefully they can do it. So I'll go ahead and move on to National Police Week proclamation. Chief Pickering, welcome.
Well, good evening, Mr. Mayor and Council. National Police Week is the annual observance in the United States dedicated to honoring the service and sacrifice of law enforcement officers who have lost their lives in the line of duty. National Police Week pays tribute to the bravery, dedication, and selflessness exhibited by law enforcement officers across the nation and shows appreciation for the vital role that law enforcement plays in maintaining public safety. Each year, during Police Week, the names of the officers killed in the line of duty is etched into the limestone wall at the National Law Enforcement Memorial in Washington, D.C. This year, 111 names will be added to the wall honoring those who died in the line of duty in 2025. This memorial honors more than 27,000 law enforcement officers who have died in the line of duty since we become a nation. And a side note, so back in 2019, when I was in Washington, D.C. for the FBI National Academy, I was there during Police Week. And one of the events that goes on is the Candlelight Vigil, where the Capitol Mall is full of law enforcement officers and families of those who have died on a candlelight vigil in one of the evenings. On a visit to the National Law Enforcement Memorial, I actually met the two stonemasons who have etched every name in the wall of the limestone. Two guys out of Colorado who come every year and donate their time to sandblast the names of more than 27,000 officers etched into that wall. So on behalf of the men and women of the Tualatin Police Department, I want to say thank you for your continued support and collaboration in ensuring the safety and well-being for our community. Your dedication to fostering a partnership with law enforcement is instrumental in the mission to serve this community every day. We truly appreciate the commitment of providing the necessary resources, guidance, and advocacy that empowers our officers to uphold the highest standards of professionalism and integrity in the service to this community. So thank you.
With that, Council President Pratt will read the proclamation.
Yes, and thank you to the whole police department for what you do for our community. Whereas the Congress of the United States of America has designated May 15th as Peace Officers Memorial Day in honor of the federal, state, and municipal officers who have been killed or disabled in the line of duty, and the week in which it falls as National Police Week. And whereas it is known that on average, one law enforcement officer is killed in the line of duty somewhere in the United States every 53 hours. Since the first known line of duty death in 1791, more than 26,000 U.S. law enforcement officers have made the ultimate sacrifice. And whereas law enforcement officers, including Tualatin police officers, are our guardians of life and property and defenders of the individual rights of freedom, and whereas the City of Tualatin is proud of our law enforcement officers and wish to recognize their commitment to the public safety profession, and whereas the Tualatin Police Department and officers provide the highest quality services and are committed to the highest professional standards, working in partnership with our community to meet the challenges of reducing crime, creating a safe environment, and improving our quality of life for all. Now therefore, be it proclaimed by the City Council of the City of Tualatin that the City of Tualatin designates the week of May 10th through 16th, 2026 as National Police Week in the City of Tualatin to call attention to our Tualatin police officers for the outstanding service they provided for our community. Introduced and adopted this 27th day of April, 2026.
Yeah. Thanks, Chief. I'm going to do the public service first. Okay. Next up is Public Service Recognition Week proclamation. The discussion will be led by Stacy, our Human Resources Director. Welcome, Stacy.
Hi, good evening, Mayor and Council, and thank you for the proclamation tonight, celebrating our city employees. National Public Service Recognition Week occurs during the first full week of May, and our city has the opportunity to honor our approximately 200 employees with this event. Our employees truly are public servants who tirelessly serve our community in a variety of ways, ranging from our police staff, the library, the court, or public works, to employees who work behind the scenes to include finance, maintenance, IS, and yours truly, HR, with our internal services. Our City of Tualatin employees can be counted upon to show up, act with heart, and perform their work in a professional manner, which has lasting positive impacts on our community. To celebrate our employees during Public Service Recognition Week, employees will be recognized each day with small tokens of appreciation, ranging from a drink of choice from a coffee truck, breakfast treats, an ice cream social, small tokens of Tualatin logoed items, and a lunch served by our executive team. This year's theme is Good Vibes, and each day will reflect the positivity and good vibes of our employees. Recognizing our employees during Public Service Recognition Week is the city's small way of giving back to our employees and saying thanks for their hard work performed year-round. Thank you again for the proclamation tonight and for helping us celebrate our employees.
All right, thanks, Stacy. Counselor Gonzalez will read the proclamation.
Wonderful. Thank you. Whereas public service is an honorable calling that involves a wide variety of challenging and rewarding professions, including providing recreational services, maintaining public safety, improving transportation, protecting our environment, and performing administrative and management activities which are essential to efficient and effective operation of the government. And whereas Tualatin City employees contribute significantly to the quality of life for Tualatin community with their commitment to excellence, high ethical standards, and diversity of skill. And whereas excellent in the delivery of public service helps keep Tualatin strong, prosperous, and a wonderful place in which to live, work, play, and volunteer. And whereas this commemorative provides an opportunity to express our appreciation for the many contributions public employees make to our daily lives. Now therefore be it proclaimed by the City Council for the City of Tualatin, Oregon, by the Tualatin City Council, that the week of May 3rd through the 9th of 2026 be Public Service Recognition Week in Tualatin City of Tualatin. And the council encourages everyone to recognize the accomplishments and contributions of public employees. Introduced and adopted this 27th day of April 2026. Thank you.
Thank you. All right. All right, now we're going to loop back to item number 2, National Prevention Week proclamation. We have a member of LEAP. Come on up.
Give me 1 second.
Sure. Welcome.
Okay. Hi, my name is Jeremiah. I like to go by Jay.
Welcome.
I am a member of LEAP, and my whole goal, and as well as every other LEAP member, is to make sure we maintain the prevention agenda of drug use in our schools and overall our city. Our first activity we are planning are mental health rocks for our art cafe. The goal is to paint positive messages on rocks to place around the school campus of Tualatin High School and the community at large. Make an impact on someone's day by coming to our art cafe on May 11 and or 22nd in room 157, or join us at Blender Dash upon the... Oh, okay. I'm sorry. Join us at the Blender Dash to support this effort. We will also bring this campaign to Hazelbrook Middle School on a date to be determined. Our second activity will be Mandela Poetry, starting at May 5th from 4 p.m. to 5 p.m. for all ages. Learn with others across the country during a Zoom training how to clear your mind and use the mandalas to focus and reflect and find your center. Powered by the Heron Project Wellness Series, LEAP and Tualatin together, location, Byram Elementary School, Portable 1. Registration is required in advance for supply reasons. And our third one is the mental health rally in front of Tualatin High School. High school in May. If you are interested in participating, helping with donuts and hot chocolate, reach out to us through Sydney. Date is undetermined. Contact Cindy at cindy@tualatintogether.org. And we have our flyer, which is Prevention is Connection. Would you like to read? Oh. Okay. Join us as we bridge Mental Health Awareness Month and National Prevention Month. Mental Health Rocks, Mandela Poetry Workshop, Mental Health Rally. It's everything we went over.
Okay. Thank you.
Yeah.
Councilor Hill will now read the
Oops, stay there,
proclamation.
Jay. Stay there 1 second.
Not so fast.
It's my first time.
It's okay, you're doing great.
Yeah, you rock, right? Okay. City of Tualatin Proclamation. Whereas substance misuse and mental health challenges continue to impact communities across the United States. According to the 2023 National Survey on Drug Use and Health, approximately 61.2 million, or 13.3%, of Americans aged 12 to 20 used illicit drugs in the past year. Additionally, nearly 6 million, youths ages 12 to 20 reported consuming alcohol in the past month. About 57.8 million adults experienced a mental health illness in the past year, and 29.5 million individuals were classified as having an alcohol use disorder. Whereas with commitment and support, these and other substance use and mental health challenges can be prevented. The focus of National Prevention Week is to change the prevention landscape by providing evidence-based and accessible resources to facilitate collective action and story sharing. By showcasing the work of our partners in prevention, we can confront the societal challenges surrounding substance misuse together while celebrating stories of prevention. Whereas this is a message we need to spread far and wide, the impact of mental and substance misuse disorder is apparent in our local community. An estimated 5,058 people in Tualatin, Oregon are affected by these conditions, and we have the power to change these numbers and, more importantly, change lives. Whereas through National Prevention Week, people become more aware and able to recognize the signs of mental health and substance use disorders. Equally important, community members from all walks of life learn what they can do to create a healthier tomorrow by helping to prevent these problems. Being a shoulder for someone to lean on, leading someone to get help for a mental health or substance use or misuse issue before it worsens, setting an example by staying substance-free, and other actions like this all play a role in keeping the people around us and ourselves healthy and safe. Whereas we and others across the United States need to recognize the seriousness of substance use and misuse for youth and mental health challenges in our communities, the power of prevention, and the tireless efforts of those working to make a difference. The small, daily actions done by individuals, combined with the actions of families, communities, and coalitions, come together to make the larger, bold movement of prevention. Now therefore be it resolved that the City of Tualatin hereby proclaim May 10 through 16, 2026 to be National Prevention Week, and call upon our community to join us this week in celebrating the compelling programs and events that support increasing awareness of and action around mental health and/or substance use disorders year-round. Introduced and adopted this 27th day of April 2026, City of Tualatin, Oregon. We'd also like to say a special thank you to the mayor in his last Tualatin Life report. The kids have all seen that, or the club, all of them have seen that, and we didn't bring our thank you note tonight, but we'd like to recognize you and say thank you for making sure that the entire community understands a little more about prevention, helping us get the word out.
My
Thank
pleasure.
you.
Thanks for coming. All right, the last announcement is mine to make. Behind me, you can see the board. The announcement of the State of the City. I'll be doing my last State of the City on May 19th. May 19th might sound like a familiar day because none of us anticipated or dawned upon us that that is primary night. So it's going to be a popular night that night. So what I am suggesting is fill out your ballot, drop it off at the library, and then drive on down to the Grand Hotel for the State of the City from 5:30 to 7:30 at the Grand Hotel. What will be involved this year is we're going to have City Council review what has been achieved the last year in Tualatin, and then I'll reflect back on my 16 years as a city councilor and as mayor of how Tualatin has changed over the 16 years, in addition, not just growth-wise and population-wise, but as it has become a better city with some fantastic amenities and projects that we accomplished together in city council. So we're just inviting everyone to come that night. The bonus that night is that we have secured sponsorship for the event, so that we'll be having free heavy hors d'oeuvres and adult beverages and refreshments. So if you have time, come join us. It is a free event. You don't have to register. Just drop by the Grand Hotel on the 19th at 5:30. I'll say get there early because hopefully it'll be packed. You never know. But again, get your ballot done first, then come to the event because it's going to be a fun event, and looking forward to saying hello to everyone and enjoying this last city council State of the City on behalf of myself. With that, we'll now switch over to the next section of special reports. We have outside agency grant awardee, Borland Free Clinic. Jordan, welcome. Oh, public comment. Oh, yeah. See? I'm just going. All right, public comment. Public comment is an opportunity to address the city council on something that's not on tonight's agenda. Please keep your comments to about 3 minutes. Again, you don't have to be signed up. I have no signups right now. I'll take the folks in the meeting room first and then go to Zoom. The folks who want to comment about the library cooperative, we'll do that comment later on. So do we have anyone on Zoom or the meeting room that would like to give public comment tonight? No? All right. With that, we'll move to the consent agenda. The consent agenda are items that are considered routine. They will be adopted by one motion unless someone in the council would like an item removed and heard separately later tonight. Tonight's consent agenda consists of 2 items. Item number 1, consideration and approval of the work session and regular meeting minutes of April 13th, 2026. And then item number 2, consideration of approval of late liquor license renewal for 2026. Would any counselor like an item removed and heard separately later tonight? Seeing none.
I move that we adopt the consent agenda as read.
I have a motion and a second to adopt the consent agenda as read. Any discussion on those motions? All those in favor say aye. Aye. Opposed? Abstentions? It's unanimous. Thank you. Now we can listen to Jordan about an update from the Borland Free Clinic. Welcome, Jordan.
For real this time?
For real. I was just eager to get you up here.
Good evening, Mr. Mayor and Council. It is a pleasure to be with you, and thank you for the invitation. I believe I was here almost 2 years ago following a significant capital project at Borland Free Clinic, and so I'm grateful to be back, and more so just grateful for the support of this community and for you all, some of you in specific ways, but all of you in terms of the grant support that we have received over the last few years. So by way of introduction, my name is Jordan. I'm the executive director at the clinic. I have been in this role since the beginning of 2022. And I also have the privilege of serving on the Chamber Health and Wellness Committee, and most recently for Washington County's CHIP Steering Committee, Community Health Improvement Program. So while not a resident, I feel very much tethered to this community. And so I want to thank you again for welcoming me in the many ways you do. I have just a few slides to introduce and talk about our work. First of all, we are a free clinic. We are one of only 2 free clinic in the Portland metro area in the Tri-County region. For those unfamiliar with the free clinic space, it is as it sounds. So like we heard from NAMI just a second ago, there are no costs attached to the services we provide to our patients. And while we do our best to keep external services, including prescriptions, at a reasonable cost, we do the best. We don't put any costs or burden, financial burden on our patients. There is, of course, other ways in which people can receive free care or discounted care, specifically through charity care programs like you might experience at hospitals or through FQHCs, federally qualified health centers like Virginia Garcia. But the problem is the strain that puts on our healthcare system, as well as the access questions. And so while most recently numbers have dipped in terms of insured Oregonians, the fact is that above and beyond healthcare insurance, what we talk mostly about is healthcare access. And so one of the things we are aware of is roughly 6-month waiting time for folks to get in to see primary care physicians, and that includes myself in non-Medicaid and non-free clinic spaces, as well as other issues accessing specialty care. So we have been around, as this timeline states, since early 2010s, but we didn't open until 2017. So next year we are excited to celebrate our 10-year anniversary, which is a significant milestone for us. In 2018, we began offering our primary care services, which is the bread and butter of what we continue to do. And then, as I mentioned a minute ago, post-pandemic, we were able to complete a $1.5 million capital build-out to renovate our corner of a vast underbelly of Rolling Hills Community Church to present our patients with a look and feel of quality health care that they receive in our space. This year, we are anticipating some enhancements in our work and a transition phase. We are looking for our very first paid provider to bring onto our staff. One of the things that it remains unique about us in comparison to not just other free clinics in Oregon, but regionally, if not nationally, is that we have yet to hire a staff member who is also a physician. And so we are able to do the work that we do and the extensive services you see offered here, thanks to the many volunteers who contribute to our work. And that includes clinicians, but also board members and other individuals who help in various ways. So we know it takes a village, we know it takes an army, and we are able to offer the care that we do thanks to many, many dedicated individuals. And so we and our patients are grateful to them. We also can't do the work we do without the partnerships that we have. And so healthcare, as you know, is a very intricate system. And so the fact that we are able to receive in-kind services like external labs through LabCorp, or our relationship with Providence Internal Medicine Residency Program, so they help staff some of our clinics, to the mobile offerings that come up to our doorstep to serve our patients. We're just able to provide more and more through that. And then, of course, there is the support. Our revenue is completely grants and individuals, and so like the city of Tualatin, we are able to do the work that we do thanks to the generous support of others. Just a little note on our impact. One thing I'm proud of is that we have grown in our services and service offerings every year that I have been around at the clinic, so that goes all the way back into the pandemic. Last year, we served over 500 unique patients, and that is pretty good for only 12 hours of services a week. And so we are proud of that number and having crossed that 500 mark for the first time in 2025. Last year, our patient appointment count, and so that includes returning appointments as well as individuals who we may just interact with over the phone through prescription refills or other interests. We were over 1,300 appointments that we're able to get. Vast majority of those, of course, are uninsured. We do offer what we call bridge appointments for folks who maybe are on OHP/Medicaid, but given their wait times, we prefer that they move on to their primary care physician. It's just depending upon how quickly they are able to make that happen. I mentioned the volunteers. Our demographics is that we have a primarily client base of people of color, 44% of which are Hispanic, for whom we offer on-site Spanish translation if needed. We estimate, there's not a science to this, but we do, or there is, but to the best of our approximation, we're able to estimate that last year we offered over $300,000 in free medical care to the community. I do want to point out that via zip code analysis, we're able to determine that about roughly a third of our patients come from the city of Tualatin, specifically. The last thing I want to highlight is just the headwinds that we're facing as a nation in terms of healthcare and the impact that that is bound to have on our communities. We already know about the complex healthcare environment in which we all reside, some of which I've already spoken about. But anything from choosing a plan to anticipated costs and determining co-pays to navigating, financial aid services to getting the specialty care that one needs and referrals, let alone wait times. There is a lack of specialty care services that we and other federally qualified health centers are able to access these days. There has been a program, you may be familiar with Project Access, that has been funded by healthcare systems over, I would say the last 10 to 15 years. That program has been sheltered due to funding cuts and issues related to the healthcare systems. And so that used to be our way of having patients who need external services to go into the hospitals to get donated care. Right now, it is sort of everyone for themselves trying to negotiate those services and making sure that patients have a place to go. We're lobbying hard and working with PANOW to help resurrect that program, but it takes time. Meanwhile, all of us are familiar with H.R. 1, the big beautiful bill. And while some of the provisions in that have yet to come fully online, some have already taken place. And so as I understand it, we've already seen a drop in enrollment coverage from around 97% in Oregon to already around 94 to 93%. And that is due to things like this. So we have an anticipated drop in Medicaid coverage due to the introduction of work requirements. So that's roughly around 20 hours a week that individuals have to be employed in order to be eligible for Medicaid, which is already a high threshold or low, depending on how you ask the question, because you can't make very much money to be on the Oregon Health Plan as it is, even with bridge programming that hopefully the state continues to fund. In addition to that, redetermination for continued Medicaid coverage is going from 1 year to every 6 months, and the administrative burden that is going to cause is going to negatively affect people. We're also looking at funding shortages across the state, as well as limited eligibility for our non-citizens. And so I have heard estimates of around 200,000 Oregonians will lose coverage over the next few years. Obviously, those numbers are only guesses at this point, and the real data lags a few years, and so we will see what happens. But we should also mention that this doesn't just affect the lowest income individuals in our community. The loss of marketplace premiums or the tax credits for those premiums, as well as increased premiums for everyone else, is a real thing. And so last I've heard, your average person making under 400% of the federal poverty line has already experienced a jump in about $50 to $200 a month in their premiums through the marketplace. Of course, assuming they can get it when it's open. One more negative thing that I'll offer. Sorry to be a downer. But there was just a series, if you're familiar with the Health Forum run by the Lund Report, there was just a series this last month on primary care in the state. and how difficult it is to access. I mentioned this a minute ago, but just to put some stats on the board here, you can see that primary care wait times in the Portland Metro lag behind the national average by almost double. The acceptance rate, that is clinics that are serving Medicaid patients in the Portland Metro, are grossly behind national average, as well as the Medicare acceptance rates. So you're just seeing less and less entities being there for the individuals who need it most. I would be lying if I said the free clinic is here to save the day. That is not possible. But we are here to do our part, and we, again, are just so grateful for the support that we have in this community and from this group. And so, yeah, we look to grow, we look to expand, and we're hoping to, meet that need as best we can. Any questions?
Great. Questions for Jordan? Council President Pratt.
I just want to clarify, like on the Medicaid and Medicare acceptance, so like Medicaid, you're saying that if someone had Medicaid and they went to a clinic, only 8% of them would accept it?
Correct.
Oh my gosh, thank you.
Other questions? Council Reyes.
Not a question, just a comment. Thank you for being in our community, and I am very proud of the Portland Free Clinic that serves a lot of people that I know within this community. Thank you.
Other questions? I just was excited. I saw on Facebook the announcement when you were looking for a new provider and your ability to hire someone. Hopefully you can find, doctors are hard to find right now, so hopefully you can find someone. The only big question I had is, I remember it's been a while with the new facility and the increased amount of privacy, the ability to serve women, and your goal to increase and ratchet up your women's services. How's that going?
Yeah, it's going well. We have a number of, I would say, gynecological specific providers, and yeah, every woman who comes through our clinic is offered that service. Twice a year, we offer a free full day of physicals as well as mammogram screenings, and that's in partnership with OHSU Hillsborough's mobile mammogram unit. So I don't have the specific numbers on how many increase, but more than half of our patients that I mentioned before are female. And so, yeah, we love that service, and we're grateful for the providers that we have that are able to offer that care.
Yeah, because I appreciate once you had the new build out that the privacy was lacking last time is now there, and that's fantastic. And how's the new facility doing? I mean, you're still chugging away, and you haven't outgrown it yet?
No, well, it depends on, I have some ideas around additional services, and there has been very, very preliminary discussions with the church around possible expansion. But as far as the space is concerned, yeah, we continue to get wonderful comments about how it looks and feels, not just from the patients, but from the volunteers who are more excited to work in a space like that than our previous.
Looks a lot more professional.
Yeah, exactly. And so, yeah, we're really proud of the space. It is serving us very well. And yeah, we have definitely grown into it at this point.
Great.
Yeah, so thanks for asking.
Cool. Anything else? Councilor Brooks.
Thank you so much for your presentation. That last set of stats I took a picture of because I think it's just so important for people to understand, and especially as we're moving forward. And I'm curious, why do you think that our state lags so far behind from your perspective on serving people that are on Medicare?
Yeah, great question. I would point specifically to a very, very progressive agenda around, I don't mean that in a loaded sense, but just a very strong push to ensure more individuals in the state without enough adequate understanding of the amount of providers that are needed to support those individuals. So I think that has been a disconnect in this state. And yes, to Mayor Frank's statement a second ago, we are looking for a provider, but part of the primary care shortage is the lack of primary care providers. And that is true across healthcare, so I don't want to say it's specific to Oregon. But primary care physicians, the generalists, the advanced practice folks, the folks who do a lot of the maintenance of care of our population, aren't always the best supported financially. And so I think that disconnect between having those, basically the workforce to support the people who have access or have insurance has created the difficulty we're seeing.
Thank you.
Yeah.
I just want to thank you for your efforts and all your work over the years and your fundraising abilities and your leadership abilities to make the Borderline Free Clinic happen and operate, here in this area, and being able to, find those funds to expand your, services and hopefully find that provider.
Yeah, thank you so much.
It's been a lot of work, and I appreciate what you've done.
Thank you so much.
All right, thanks, Jordan. All right, so that brings us to general business. Item number 1, eviction prevention discussion. Megan, welcome, Megan.
Okay, testing. Good evening, Mayor and City Council. My name is Megan Cohen, and I'm the Homelessness City County Liaison for Tigard, Tualatin, and Sherwood. I'm just getting over a cold, so apologize if I have to take a drink of water. I'm here this evening to, as a follow-up to my last presentation on safe parking. There was interest expressed in exploring some other options, including getting some more information around eviction prevention. So that's what I'm here to do this evening. It'll be a really high-level overview of what it sort of looks like in our area right now and what is happening locally. So with that, I'll go to the next slide. So the agenda will cover some background on eviction prevention, current landscape, Tualatin investments, enhancement options, and then, of course, time for questions. Should breeze through it pretty fast. So just to provide some background of why we are here this evening, like I mentioned, we had a safe parking presentation in August 2025. Coming out of that, council had expressed some interest, not in looking at safe parking moving forward, but other options to support eviction prevention as sort of the underlying issue for that program. We've also had a series of other sort of public conversations. One was the Housing Forum in December, which Community Development put on. Really fantastic. Thank you all for being there. I think we heard from our community that evening about several different challenges, including accessible transit to affordable housing being a huge barrier, which I know you all have been working on that issue with TriMet. Hearing about the additional utility payments that people are paying on top of their rent, which vouchers aren't covering, and then just hearing about sort of the ongoing challenges around cost of housing, finding affordable housing, those things as well. And then at the City Council advance in January, you all identified eviction prevention as one of your City Council priorities, priority 2.4. You'll also see I listed the priority 2.3 on there about sort of staying informed around SHS, including Metro, which I'll come back to later in the presentation. And then one thing that didn't make it on the slide, because it's so recent, is last weekend's forum at St. Anthony and the discussion that they held on immigration housing, which I know 3 of you were able to make it to. The best showing from all of the cities, actually, which is great, I think, for Tualatin, and just the challenges we heard specifically from the Latinx community there on issues that they're having with tenancy, with being able to find good, secure, and affordable housing, and then sort of the challenges on top of that of immigration enforcement in the area. So all of that kind of brings us here to chat a little bit more about what we're looking at in terms of what's available for eviction prevention right now. So starting with what are the funding streams? Eviction prevention comes from sort of all the streams, federal, state, Metro, SHS. We're kind of in that sweet spot, right, of having both Washington and Clackamas County. And then private sources such as churches. All of the sources across the board have been cut in the last year by 50% or more. Pretty serious cut. And it has had very felt impacts. Need has also risen, of course. Right now, in this moment, how do people get rent assistance? There used to be sort of this process of, okay, I call Community Connect. I have to have my eviction notice. If I have that eviction notice, then they can go through the process of paying my landlord and resolving that. Well, last year that changed, and it was now you have to wait till you get to eviction court. So when you get to eviction court, there will be a provider there. They will be able to help forgive that so that you can move on from that. Well, that is no longer available. So right now, the only source of rent assistance outside of those private sources or local connections is that you have to be receiving services from Community Action, and then they can provide rent assistance through the funds that they have available, which are extremely limited at this point in time. Other than that, we've seen our community really galvanize around doing like GoFundMes for folks, trying to figure out how to do shared housing, get really creative. And I think in the provider world, we sort of have two strategies. One is just real talk with people, having conversations about paying for rent and getting everything else covered through any other stream. So making sure that your food is coming from a food pantry so you don't have to pay that cost. Getting utility assistance if there's a provider that's able to pay for that. Being able to just wherever you can get those other costs covered, the primary amount that you're making should be going directly to rent, because that is going to be the hardest one to cover. So that's one conversation. The other conversation is really just on safety planning, like what's next. We know that we're not going to be able to get you out of this situation. Is there family that you can move in with? Is there temporary living that we can figure out for your kids? Are there shelters that we can start to look at referring you into, because we know that the shelter wait list can be anywhere from 2 weeks to a couple of months. So those are kind of the conversations that we're having with people who are finding themselves in the situation of not being able to pay their rent. And that is really the primary source of eviction here in Washington County and Oregon. So on the lighter side of things, we do have some local Tualatin investments. We have the Tualatin Outside Agency grants. We've been able to do a few grants to organizations like Just Compassion and Family Promise. They're not necessarily eviction prevention specific. Some of them do like youth programs or moteling, but they are supporting organizations that are helping to move and use funds creatively to help people and bridge those gaps between when people might lose their housing and get new housing. So it really does, any way that we can support those organizations is always really appreciated by our providers and recognized for that investment from Tualatin. There's my position. I'm just the problem solver, I guess, in this area, trying to figure out how we can connect, how we can get people into the right places to make sure that they are connecting with people, and that as soon as they can get access to a service, they get it, and they're not having to wait more time. I think that's really my ultimate goal, is everybody is aware of SHS and knowledgeable about it directly in our area, which I think we've had a lot of success doing in the last year and a half. We also have our utility bill assistance program here. That's run through Community Action. That's a great assistance program to be able to do some of that forgiveness around utilities. There's different qualifications on that, but it is something that we're able to offer. And then the last two that are sort of around this are the legislative agenda, which has included housing and eviction prevention and advocacy from you all, and then also investments in affordable housing like Plan Beck, of course. So those are all things that help make housing more affordable and look at what kind of policy and change can we have here locally that will make it a little bit easier for folks. So we've identified a couple opportunities for enhancement. The first is just sort of continuing that legislative agenda advocacy. I think specifically, identifying opportunities where the state can provide more funding or at least not cut more funding around rent assistance, anything in that area that would have an impact. The second one is outreach and connections to services via our library and police. I wanted to share one awesome thing that we've been doing for the last 3 months while the Tigard Library's been closed. We were able to connect with several providers who have been tabling at the Tualatin Library, so Comfort Zone, Home Plate, and Just Compassion, and they've each been there once a week directly connecting with folks and trying to get them connected back to services. It's been a really awesome opportunity. Unfortunately, both Comfort Zone and Home Plate are being impacted by funding cuts, and so they won't be able to continue. But we've created, I think, a really great system with Just Compassion and just trying to make those connections directly at the library and refer folks in. So I think just doing more of that. We've also had really great experience with the police, and when they go out like to a Motel 6 where somebody's being asked to leave, referring them directly into emergency shelter and those types of things as well. So I think just finding more opportunities where we can do that would be helpful. Third is the involvement in decision-making at the county, metro, and state level. I think most importantly, the SHS RPOC committee has now kicked off in its new form. And so I think I could do a better job of following those meetings and just following what's coming up for conversation there, advocating for Southeast Washington County. And I know the mayors are really involved in that as well, and just trying to figure out what voice can we have in that process. And then the last two are really specific to Tualatin. There's the option to sort of focus the outside agency grant program allocations. So we could do something like put priorities over the grant allocations and say we really want to focus on funding housing or eviction prevention projects this time around, or dedicating a specific amount of those grants to that. Could look all sorts of different ways, I think, and or dedicating a new funding allocation specific to that. So that's sort of the very large overview from big to small on different opportunities there are for enhancing this. And with that, I will just turn it over to questions.
Questions for Megan? Councilor Brooks.
Thank you very much. My first question is when we talk about the gap, so you said 50% of the funding, and then there's all these access limitations and entry point limitations. I guess the first thing is I wonder if you could just send us that in like a form, because I think if we were going to do advocacy with anybody, if we have all that information together, we can talk about what we've heard in listening sessions from our community, if we're going to do a tailored approach for our community with a community needs assessment, and then have that information. And then I'm kind of curious what the gap amount that we've lost is about. So if we were going to talk about funding allocations, would it be specific service providers that we could tap? How would we bridge those lost connections and make those determinations? And so would it just be a dollar ask, or would it be finding out where there might be money from foundations or any other unlooked at monies? So that's my first question. And then my second question is, what was my second? Can I see that one slide again? The last one? Was it?
Thanks, Brooke.
Well, yeah, I guess it was the money and the information, I think, that you gave us in the first point. I think those were my two questions, so sorry about that.
No, that's
great. And I appreciate you being at the that Saturday event on the 18th. One of the other things that was brought up from that was tailoring resources for landlord.
That's right.
And the idea was that there's some landlords that are really responsive and some that aren't, and is there a way of having some kind of a database? Some cities have done that. And I think it would be good for both education of programs that are available, as well as what the rights are of tenants, and then if there's been a history of really, really bad things. Like we heard a couple stories of things that really nobody should live with, that I feel. Thank you.
Thank you.
Councilor Sacco.
Thank you for your presentation and the work that you do. Focusing the outside agency grant program allocations, I think that's an interesting idea. And, I would love to give to everybody that applies, and would hate to not sort of continue what we've been doing. However, if we deem that this need is greater, I would be interested in understanding how much we give goes to not only specifically eviction prevention, but like the food pantry, like you said, right? Like that those services help keep people housed as well. Yep. And also, there are multiple agencies that we give to that I think contribute to that, but I would be interested to learn if we gave larger amounts to certain agencies, would they be able to do more with large, I guess making sure that our dollar is working the hardest that it can for our community. Yeah. That's what I'd be interested in learning. And then could you explain maybe a little bit more the new funding allocation and kind of how would that work? What would that look like? And I know you probably don't have all the details, but just a little bit more information about that bullet.
Sure. I think if that's something you wanted to look at, we could discuss some options and bring something back. I imagine we've seen some other municipalities like Hillsborough dedicate specific eviction prevention resources. Most of them have done it for families impacted by immigration enforcement, which was a big need in the fall. And so what they did is they just, had a dollar amount, dedicated those fundings. They were direct allocations to organizations that had connections with the community, and then those organizations were responsible for doling out the eviction prevention, rent assistance payments. So I would imagine something similar could also go through a grant process too, but I'm not imagining something that we would run, but that we would probably grant or contract to outside agencies that already have the ability and the knowledge on how to do that.
Councilor Hillier.
Thank you for all of the above. And to dovetail on Counselor Sacco's question, I'm curious to know also in that list if there are agencies that maybe cater to youth and 0 to 22 probably, if you will. And I wonder how many youth right now are being impacted, do you think, in our community? And if you don't know, that's a really not on this, but it's something I think about, so you can answer me later if you want.
I can get more specific data. I know that Oregon struggles with the highest rate of youth homelessness in the nation. Home Plate has been reporting a lot of challenges with serving youth. More of them are inside families than outside, like unaccompanied youth. Yes. But definitely seeing a lot of youth being impacted and having some conversations with the school district as well.
Thank you. I know Dorian at Home Plate is just, any dollar that goes to that place is a dollar well spent. I'm kind of curious, at one point we learned that there are other low-income providers here in Tualatin outside of Plambeck, and I just wonder, are they as long of a waiting list kind of as everyone else, or how do we partner with them? I mean, Plambeck has a different, setup, and I get that. And I'm just wondering about the 1 or 2 other places here in Tualatin.
I would have to go back and look. I know that we have some properties that have LIHTC in them, so they're not necessarily run, like by a SEPA. Okay. They just have requirements in terms of the AMI that folks are making coming into the units. So it's less of sort of a dedicated process like something from SEPA or REACH.
That makes good sense, thanks. And then my final thought is, maybe I'm just not understanding the nuance of the term houselessness, but it seems like we focus on rent. And I wonder about people who own their homes that are behind because of all these circumstances. And are these resources the same for people who have a home and could experience houselessness? I get that they have an investment, but I mean, the goal is to not have them have to sell their home to. So I was just curious about that.
Yeah, that's a great question. It is not the same. There are organizations like Open Door Counseling Center is able to do some mortgage assistance. I don't know what that's looking like these days, but I know they've been able to do some programming around that. A lot of that is, again, working with folks to maybe think about doing shared housing or something like that as well. So it is in sort of its own realm from the rent assistance.
Yeah, thank you. And it just feels like that should be included in our conversations a little bit more. I think we're going to see shifts in the next 18 months.
Strongly agree.
Yeah, so I would just love us to, and even if it's learning on our own, send us education or whatever it is so that we can use the right language. But I'm pretty passionate about that. Thank you for all your work, and I think all your ideas are great. I wish that I could even personally give more to some of these agencies. So this is really important work. Thank you so much.
Thank you.
Other questions? Council President Pratt.
Thanks, Megan. I guess I came to eviction prevention because I talked to just Compassion, some other organizations, and said, to me, it's like, how can we most effectively use the dollars we give to help the most people? So that's what I'm looking for. And I guess is there I don't know if you could do this, but a dollar amount, for every $500, it does this kind of thing. So it's real clear.
Yes.
Concrete, because I like that.
Yeah, we can definitely bring that back to you.
And then the other side of it is on the legislative agenda, advocacy and the involvement with the county and metro and the state.
and I don't want to put more on you, but like if there is something upcoming where we can advocate, is that something you can like shoot an email to the mayor because he's good at sharing? And so that way, because some of us do write letters and talk to people, so we'd be glad to help advocate if it's a big issue.
I appreciate that. Please give me more work. I'm always happy to be more in Tualatin. Yeah, I think a good example is one of the things that I had learned about was the Portland mayor's ask to Washington County for SHS fund, and that was something that I tried to get out as quickly as possible. So the more I can be in spaces where I can hear some of that, I'm happy to make it back to you all, and then if I can be helpful in providing more context or anything like that, I would love to do that.
Great, thank you.
Any other questions? Councilor Brooks?
The other question I had was about the utilities program that we're running. So is there, have we used all of our dollars? How's that program been going, I guess, is my question.
I would have to get back to you with the exact details. I think we do it on like a monthly allotment, and there's sort of a dedicated amount. So I think it's been budgeted out, and I'm sure we'll expend the funds for that program.
Okay. Yeah, I'd just love to see how it's going so that when we're taking all these things into consideration, if there's something that's lagging, that we can understand that when we're looking at this overall picture. And I very much appreciate your work.
Any other questions? Right. Well, very much appreciate your work. As Council Brooks just said, Megan, I know it's an uphill battle for you every day. Your job's not getting easier. Dollars are being cut, and it's impacting people, and it's frustrating to both us and you, trying to keep people's lives intact with dwindling resources and exceeding demand. So I give you credit for what you do, and I appreciate what you do for us.
Thank you. I think we're lucky to be in a community that has amazing things like Borland and those types of services where, when your medical costs aren't being covered, that can be another reason to be evicted. So it's great to be here this evening, get to hear more about what they do too. And I think I've got a lot of feedback from you all this evening, so I'll take that back and then get back to you with more information.
Appreciate it.
Thank you.
Thank you. That brings us to item number 2, a review of library cooperative intergovernmental agreements between the City of Tualatin and Washington County. Presentation will be given by City Manager Lombos. For folks in the audience who want to chat about this, what I'm envisioning is we'll have Sherlyn do her presentation, then I'll open the floor to folks who are signed up or don't have to be signed up, who'd like to comment on the presentation or their thoughts on the library cooperative IGA drafts, and then we'll go into Q&A, the counselors with Sherlyn. With that, the floor is yours, Sherlyn.
Thank you, Mayor Bubenik and members of the City Council. Before I start this, I am remiss in my manager's report to not call out it's Bates's birthday today.
Wow.
Bless his heart, he had to work. I told him can you send us staff? And he's like, no, there's nowhere else I'd rather be. Anyway, so thank you for being here. Yeah, so let's just jump right in. I feel like I've got quite a bit of detail in the presentation, and it's probably more detail than I would ever recommend our staff including in presentations. However, given the visibility of this and the sensitivity around it, I thought it would be a good idea to get into some level of detail. And so we're going to talk about the background and history of cooperative agreements, getting here and the timeline, who makes up the cooperative and who's responsible for what, and then a word about the centralized collection project, since that is called out in who's responsible for what. The funding of the cooperative, which is a big piece of this, the structure, roles, and decision-making, and then accountability. So just a little history of the cooperative. So it was formed in 1976 after Beaverton put in some money for a study of library services, and then a number of communities went together to form the cooperative. Then a voter-funded tax measure for libraries in Washington County was passed in 1976. When Measures 5 and 50 went into place, that was rolled into the general fund of Washington County. There's been a strong historical commitment, although not a legal commitment, which we found out a number of years ago, several years ago, that there was no legal commitment for that, but there has been a strong historical commitment to designate those funds for libraries. So in 1977, Tualatin joined the party. And then starting in 2006, there have been a number of local option levies every 5 years that have been passed to supplement the funding of the Washington County General Fund. Of the 26-27 total WCCLS budget, which is over $51 million in year one of this new IGA, approximately 45% is made up of the county general fund and 55% is the local option levy. So we're currently under two separate IGAs. The first one is called the Washington County Cooperative Library Services Agreement. It is a perpetual agreement between the members of the cooperative and Washington County. The current agreement was created in 2006, approved, and there have been two amendments since. So one in 2007, which added North Plains to the cooperative, and then in 2016 added Aloha to the cooperative. Right before so 2015, when the local option levy, when we were going into that local option levy, the levy was raised to account for Aloha, and then once that levy was passed, Aloha joined the cooperative. So that IGA sets up governance structure, roles, and process. So it creates a governing, or says who the governing body is, the executive board, and the policy group. The second is the Public Library Network Services and Funding Agreement. So that is a 5-year agreement that follows the term of each one of the levies. And so this one we're under right now is July 1st, 22 through the end of June. Well, it says June 20, it should say June 30. Typo. June 30, 2026. So this outlines all the operational terms, so the minimum operating requirements, ownership and management of the information network, which is a really big deal, the services and support provided by WCCLS, the services that are provided by the member libraries, and then the funding. So that first one there is going to be replaced by this new governance IGA, governance agreement. It does add much more detail about roles and responsibilities. It tightens up definitions and structure. It goes from approximately a 9-page IGA to, I think, around a 20-page IGA or 16. And that is because it adds quite a bit of detail around structure, roles, and responsibilities. The second one, the PLN IGA, is the new operating agreement. And again, it has much more detail and clarifies many things. It fundamentally changes the funding structure, and we'll walk through all of that. So how did we get here? So the Funding and Governance Project started back in January of 2024, when it was anticipated that we were going to, that the levy was going to be up at the end of, it was going to be on the ballot in November of 25. And the library director and I were directly engaged and involved hundreds of hours across the cooperative working on the funding structure and the governance project. In October of '25, the funding allocation methodology and service boundaries were approved. We brought that to you in September of '25, and that was the basis of your support for the levy and moving forward with that amount of the levy and the allocation, how it was allocated. Of course, in November, the 5-year local option levy was approved by 58% yes, so strong support throughout the county. And then starting in January through right now, we've been working on the governance and IGA with all of the members. Kind of a broad statement before I get into the rest of it. So the IGAs are laid out in a structure not of my doing. And it doesn't always make sense to me, to my pea brain. So how I am going to go through it is kind of random because I think it will tell a better story of the cooperative and who does what and the funding. But by the end of it, I think we will have gotten through both IGAs, and we can pull up the IGAs and walk through them if you would like at some point. But I think how I've laid it out, how this has been laid out, is a little more intuitive, at least for me. So who makes up the cooperative? So Washington County, WCCLS, Washington County Cooperative Library Services, is a department of the county. They are governed by the Board of County Commissioners, and they provide the critical infrastructure and support services that connect all the independently operated libraries into one countywide system. And that is laid out, and we'll talk through that. There are 12 member libraries, and they're called contractors in the IGAs. So 9 cities: Banks, Beaverton, Cornelius, Forest Grove, Hillsborough, North Plains, Sherwood, Tigard, and Tualatin, and then 3 nonprofit libraries, so Aloha, Cedar Mill, and Garden Home. So they each have distinct service boundaries and service populations. That is a new thing in this operating IGA. We have never had service boundaries or service populations. The funding allocation was built on service metrics like collections and circulation, and then it became very much a black box of an unexplainable and hard to defend, to say how much Tualatin was getting versus Tigard versus Sherwood. And so this new funding methodology is based on a clear and defensible methodology. So Section 14 of the operating agreement outlines those service boundaries and service populations. Just to talk about Tualatin's a little bit, Tualatin's service population is 30,148, and is based on what is in our boundary. It also includes the city of Durham, and what it does not include is the unannexed area in Basalt Creek. So there is a section in Section 14 of the operating agreement, Section 14.5, that's called modifications resulting from annexation. And that outlines when we annex that area in Basalt Creek that we anticipate annexing, that will be added to our service population. Although there is not anticipated to be residents, but we still want to, the part that's annexed right now is ours, but.
Industrial area.
Does that make sense? You want to ask a question about that? Or? Oh, that's annexed. That's annexed, so that's in our, yes, exactly. West of Boone's Ferry, essentially. All right. So let's talk about who's responsible for what. So this is outlined in Section 12 of the operating agreement, base service levels to be provided by the contractors. This section is greatly expanded and clarified. The only requirements before were essentially two, that member libraries had to be open 45 hours a week and have one full-time equivalent employee. So we spent many hours talking about what base service levels were and what was valid for, that we basically would get paid for. So collections and materials, 12.1, local collection comprising books, media, other materials at a minimum through June 30, 2027. And we'll talk again about the collection centralization. However, the at minimum doesn't just refer to the collection centralization. It also, we can provide and maintain local collection. It's still undefined of what amount that will be, because that's part of this collection centralization process, but at a minimum and potentially into the future, we provide and maintain the local collection. We also provide and maintain, well, this is after June 30th, access to community-focused collections comprising physical books and media in priority languages to meet local patron needs, provided by WCCLS. So that refers to what will happen after the centralization collection project is complete. 12.2, community outreach and engagement. We have to provide a website that has all the information on it and also link to WCCLS. We provide personnel, so we have to provide staffing sufficient to support 45 open hours a week. We provide, I'm going to put 54? 64 open hours a week, so we're well above the base service level. At least one full-time equivalent employee, exempt employee, so that is a supervisor, a library director, manager, supervisor, and then schedules to ensure paid staff are available during those open hours. And then programs and services, I listed in summary here, but in-person services and programs for people of all ages, and then regular and consistent programming based on community demand. You know this, we do an amazing job at all of these things. We are known for our programs and services. Sarah Jesudasan is here. She's our public services manager, and she brings an amazing network of programs, of folks that bring programs, and I think hands down we are known for having our programs and services are what is the top? Let's go with top notch. Yes.
State of the art.
Yes. So we meet all of these in spades. Continuing on in section 12, technology. So we provide staff computers, scanners, and printers, circulation technology to support the operations, and then free public access computers with internet access. We also provide and maintain public spaces, so access to the buildings and services, and then a minimum of 45 hours of open every week. So a characteristic of the cooperative is that the money cannot be spent on, the WCCLS money can't be spent on the building. Routine maintenance it can be, but all the member libraries own and operate their own building. And so we can't use the funding for land acquisition or construction. So it is our library. And then operations, so basic policies in place and annual statistical reporting that's required. Also, in terms of what we're responsible for, so Section 8 outlines of the operating agreement, outlines the duties and responsibilities for the network. So that is a huge part of the WCCLS program in and of itself, and we have duties and responsibilities associated with that. I will say that Bates and his team have had their eyes on the IGA in terms of making sure that they have comments in that it works for us. And And then section 15.1 of the operating agreement talks about compliance with Title VI. Back a couple sections, because I wanted to talk about us first before I talked about WCCLS. So section 10 talks about what WCCLS, the county department, is responsible for. So they're responsible for the base service levels beginning July 2027, as according to the plan right now. Community-focused collections comprising physical books and media in priority languages to meet local patron needs. They provide access to the ILL, the Interlibrary Loan Service, mail service to folks that are homebound. That is a service that WCCLS manages. They manage the digital collection and then also digital learning tools and databases. Community outreach and engagement, WCCLS provides a website and then countywide engagement and partnerships. Technology, this is a really big one. Free public access, wireless internet access, so the Wi-Fi. Online catalog access 24/7, an events calendar interface, the integrated library system. They provide inventory tags, security tags, and all the library cards that we use. All the circulation technology, and then the information network as outlined in section 7. In terms of operations, they also have basic policies and annual statistic reporting requirements. They also run the courier service, pickup and delivery, which is an integral part of getting the materials throughout the cooperative, and then facilitation of reciprocal borrowing agreements. There's 3 other sections that talk about WCCLS's responsibilities. So section 3 is ownership and management of the information network. Section 7 is duties and responsibilities of the network, and then the compliance with Title VII of the Title VI, I'm sorry, of the Civil Rights Act. So just a word about the centralization project. So this is a multi-year effort to transition from a decentralized model of collection management, and I know you can read as well, but to a centralized approach. So this was identified in the Funding and Governance Project as having the potential of saving and what is touted as the number is $2 million savings system-wide. There has been some question of whether that is an accurate number, but that is the number that has been associated with centralized savings. Currently, all the member libraries manage their own physical collection, so the digital collection is already centralized. WCCLS manages all of that, including all aspects of the process from acquisition to disposition. So we have folks in our library that work on all of that, acquiring, then, and Sarah can speak much more eloquently if you have questions about all that entails. We budget just over $200,000 that was in 25-26 for collection development. So, and that gets allocated by youth and adult and all the various collections. The primary drivers for this effort are efficiencies across the cooperative. So duplication of effort. Every library has folks that are doing something of the same thing. And then lack of consistency in how each member library does this, and so in policy and practice. And then there, like I said, financial savings realized as a result of the efficiencies. I will say that Tualatin has been in a different position than many of the member libraries. many of the member libraries are facing budget cuts, and the attraction of these savings is very real to them. And so through this process, any savings realized, we are able to keep. So in Tigard, for instance, they have approximately, this is a guess, but it's an educated guess. Let's say 4 staff people that are dedicated to collection development. They are able to not fill those positions and realize that savings. They also are not, like, we wouldn't, if we cut the full 210, we could cut the full 210 and keep that for other, if we needed it for other areas in the library. So the attraction for libraries that are facing budget cuts is very real. And the centralization project is not being driven by Tualatin, as I'm sure you know, but it is being driven by member libraries that, both big and small, that are facing real budget challenges. So the timeline for this project started in February in discovery and readiness. We're in that phase right now. It was launched, and there's a lot of data collection. There's a contractor, consultant that was hired, ARC, that stands for something. They've done site visits. They are working with our staff. We had a number of our staff participate and give lots of good information. They're doing a current state assessment. When that phase is complete, then it will enter into design and co-creation, so policy and procedure framework and all of the things necessary to implement, ultimately leading to the goal of centralization and implementation, and the stated date has been July of 2027. We'll say that, it's on the next slide, but we are very unsure of that time frame and want it to be the right approach, not the fastest approach. And so we are advocating for an expanded timeline if it's necessary. And the consultant has said that they will recommend that if they find that it's not workable by July of 27. You know this, but the local collection is highly valued by our users. This somewhere, hang on just a second. Yeah. There was a survey conducted in 2024 when we first started this funding and governance project, and respondents indicated that selection of materials was the second highest factor in choosing which library to visit, only second to location convenience. So what we are advocating for is timeline adjustments and flexibility as needed, a phased rollout as appropriate. So there are certainly some collections that we have that would make ultimate sense for being centralized right away. That it's just, there's not a lot of difference between what happens at our library versus what happens at Hillsborough versus what happens at Sherwood on some of those collections. But others, we may not be phased out as quickly or phased in as quickly. So then a system that allows for some local collection ownership. Like I said, we are willing to hold money and buy materials and have a local collection that matches our patrons and our community. And so we will want to advocate for that. And I do believe that we have indications that allow us to believe that that will be possible. And then a community-focused collection as informed by our staff and our patrons. And then involvement is in what is spent on collections at member libraries and input into how that money is broadly allocated among the collection areas. I feel like I had something about, hang on just a second. Oh, yes. So there are benefits to being part of the cooperative. Really. So access to all items. And so Tualatin owns right at 100,000 physical items is in our collection. The cooperative members' holdings is about 1.5 million. So we have, our patrons, we all have access to all of those as opposed to the 100,000 items, materials in our library right now. And there's a huge benefit to having access to all of that. I know as a library user, I go on the website, look for Women by Kristen Hanna, and put it on hold. I don't know whether it's at Tualatin or at Forest Grove. All I know is that I get a notice 3 days later that my book has shown up, and then, oh, I see it's from Cedar Mill. And it is very seamless to the user. I know people do come in and browse, absolutely, and our local collection is really important and has to be unique to Tualatin. But there is huge value in having access to the entire collective. So a little bit about the funding. It's actually a big, huge thing. So Section 16 covers all of this and Exhibit C of the operating agreement. We presented this to you in September of last year. Basically, it starts with our service population. So I mentioned that our service population is about 300,000. It's about 30,000. And then we're given a number of FTE units, and ours is 15. And there was a calculation around that. And then that is multiplied by a number that, so it's 128,000 per unit. And that is an average of what the members, not the nonprofit members, but all the member libraries of what an FTE is with all the overhead. So what it costs to provide the base service per unit. So that's multiplied 15 times 128,000. We get our base service allocation of 1.9 million. Then there was a shoring up. So we determined that every library would get at least a 5% bump from where we are currently at. So Tualatin in the 25-26 budget was at around 1.9 million, actually a little less. So they gave us a 5% bump, which is 57,000. So our proposed allocation is just a little over $2 million, and that is the base for year one. And then everything escalates after on top of year one. So year one, 26, 27, $2 million and change is our allocation. And that's, again, documented in 16.3.1, the allocation model. 16 also talks about the purpose of funds. We mentioned this a minute ago, the provision of library services, the base service levels, the allowable costs, so we can use that for overhead, administrative charges, routine building maintenance, furniture, fixtures, and equipment. We cannot use it for capital improvement. WCCLS will maintain a 3-month fund balance, which is different than what the county policy is. It is smaller, and a number of libraries argued for a smaller fund balance because than the county has, because we all have our own fund balances, and so that ended up being less than the county. They agreed to that. And then the funding distribution of how the funds will be allocated. And then the revenue in years 2 through 5, how that will be escalated or reduced. And there's a chart that talks about, like, if the general fund, the county general fund, and the levy see an increase, then our allocations increase by that same percentage. If the general fund and the levy are flat, then our allocations are held flat. And if the general fund and the levy decrease, then our allocations are decreased by that same percentage.
Council Brooks.
I feel like it's a lot of information. I have like questions piling up in my head a little bit here. I just want to understand the first thing, which is the amount of people that they're estimating that we have in our community. And I can understand for residents, but we always talk about we have more people that come in to work here, 30,000, I think, a day, than we have residents of 28,000. And my other question around that is, I know that we have more people that live here now than in Forest Grove, but Forest Grove's numbers are bigger than ours for some reason. So that was just a quick look. So I'm just kind of curious about the numbers, the allocation numbers. And then I guess the reason why I just had to stop here is they're already having a downturn in their general fund as we speak. So I don't understand how you have a baseline. Like, I don't quite understand where we are right now.
So the general fund increase or decrease is intended to be the property tax increase or decrease. And we are not in a decrease of property tax.
No.
So so it like, whatever the projection is, which they projected like 4% for the coming year for 26, 27, general fund property tax increase.
So we're saying it's the general fund, not the reality of the general fund, but what the
property tax
the
increase.
factors are of the general fund? Okay.
Yes.
Okay.
And that is certainly true for the levy, because the levy is calculated at like.
From the
It's a property
assessed
tax.
value,
Mhm,
yeah.
Exactly.
Okay, so that was my one. And then I have a question just about, like, you talked about doing our own collection, still maintaining one, or if we can get that across the, I'm confused about the collections, because I know that we have those book sales that we do to benefit the library, and then we have for the foundation. I'm kind of like, we have a way that we can already get books from other libraries right now. So I just don't understand what the difference is between centralizing our collection and having the whole, like, we can already access books from other libraries right now. So I don't understand the difference here exactly. I'm just not clear.
Can we come?
Yeah, we
back to
can.
that,
I just
or-
am just
Yeah.
confused. So those were just my questions that came up.
Because I'm trying to hold questions to the end because,
Yeah, 'cause she might
Yeah.
have the answers.
yeah. Yeah, because Sherilyn's got a lot more slides.
Got a few more.
Just write down the question.
That's, yeah.
Sorry.
But Councilor Sacco, do you need it right now?
Well, just real quick, because you said in the way that it's intended, the general fund is intended, and so that specific, I guess, language, is that the way it's written?
No.
Okay.
So this next slide.
Okay. Thank you.
Nice segue.
So total projected revenue is the local option levy revenue plus the delinquent local option levy taxes plus the county general fund transfer. equals the total revenue.
Transfer.
And what is written in the agreement is projected county general fund transfers are determined through the county's annual budget process. That is a risk. It's a risk. This chart is the example of what is forecast, but that is what is written. And the county has adamantly said, the Board of County Commissioners has said that they will not commit a dollar amount to, that it is through their annual budget process. So in the asks at the end, I personally think that this is the biggest risk of the entire, both of the IGAs. If we're, I said in the former slide that the 45% is the county general fund of the 51 million. And that if, I mean, that 45% is a lot. And if they determined that they are going to take that away, we can't sustain our life, but nobody can. Like that is the cooperative. So that is the biggest risk. I will say that even through these last 3 years of budget cuts, so the county has had huge budget holes, and they have continued to transfer from the general fund to WCCLS, and we have seen an increase every year in our allocation. They have maintained that. And they have maintained their commitment to the digital collection, even in budget cuts. So if that history is comforting at all, they have maintained that commitment in huge budget cuts.
But the increases weren't as high as they were supposed to be.
They were not. They were not. We got 2%. We got 2% one year and 1% one year.
No, she's got more.
Okay, sorry. Revenue from user fees, so we retain if we collect revenues, fees, we keep them. Adjustments and distributions, so I don't think this would ever apply to us because we don't have a branch. Hillsborough and Beaverton both have branches. But if you open an additional branch, you don't get additional money in the term of this agreement. And if you close a branch, you must maintain at least one service outlet. But if you close a branch, you don't get a decrease either. And then they'll distribute the money quarterly. To talk about the structure of governance, so this is the structure for the cooperative, not our local library. So when we say the governing body is the Washington County Board of Commissioners, that doesn't mean the Board of County Commissioners is the governing body for our local library. You are the governing body for our local library. You determine the budget. You determine what happens. We determine what happens. Tualatin staff or our staff, but for the WCCLS, the governing body is Washington County. Then there's an executive board, so that's outlined in section 4 of the governance IGA. It's 12 voting members representing the 12 contractors, and it's the city manager or designee. And then there's a number of non-voting members, including the Washington County administration, the WCCLS manager, and then the chair and vice chair of the library leadership group. Then the library leadership group is also outlined in the governance IGA, same type of thing, 12 voting members, and it's the library director or manager or designee, and then non-voting member is the WCCLS manager. And then WCCLS has its own section of governance. So the exec board roles and responsibilities have three main ones, and then there's a number of things outlined under each one of these. So strategic leadership, oversight, and accountability for the cooperative. We're the liaison to our local organizations and governing bodies, and advisory to the Board of County Commissioners, the county administrator, and the WCCLS manager. There's a schedule of meetings, not fewer than 4 times a year, election of officers, quorum, voting. I put in here 1 vote per member of the exec board. There's been a movement, primarily of the larger libraries, that has not been supported by everybody else, to have weighted votes, and Tualatin has not supported that, and what's ended up in the IGA is 1 vote per member of the exec board. And then there's some information about adding or subtracting members. The Library Leadership Group, which was formerly called the Policy Group in the existing IGA that this replaces, has operational leadership and subject matter expertise for the cooperative, liaison to local staff, community members and advisory groups, and then advisory to the exec board and WCCLS manager. Again, there's a number of things, other things that are addressed, including that they meet monthly or as needed, and then again, they get 1 vote each. And there's a lot of detail under each one of these, 5.4.1, and I see another typo in there, I'm sorry. And then WCCLS has a list of roles and responsibilities as well. So they are responsible for funding, infrastructure, leadership, collaboration, coordination, subject matter expertise, and providing infrastructure and cooperative-wide library services. They are the steward of WCCLS resources and services that link all the libraries, and then they're the liaison between the board, the administrator, the exec board, and the library leadership. So decision-making is listed out fairly well. So it's in section 7 as well as in attachment A, the decision-making matrix in the governance IGA. So collective decisions are defined as actions or recommendations that materially affect the cooperative, governance, funding, and services. And then 7.2 outlines the decision-making structure, and then a voting mechanism for collective decisions. We're requiring 2/3 majority vote. That became very important going through this process, and we all realized and agree that the 2/3 majority vote is important to maintain. And then failure to achieve a 2/3 majority vote, there's a process for when that happens. And so then attachment A in the governance IGA talks about collective decisions and has a long list of what the collective decisions are. And then local decisions, which it has a list of those as well, which we agree with. And then the WCCLS decisions, which are much more limited, but in paper. Accountability, and this is, I'm almost done. Section 17 of the operating agreement, so we're back to the operating agreement, talks about accountability. So we have shared reporting requirements. We have to demonstrate compliance with the agreements related to use of the library funds and delivery of the base service levels. We agree with this. It is important to be accountable, for all of us to be accountable. Having ongoing communications, and then a cooperative process for addressing issues. This did not exist anywhere in any of the IGAs. It is a little loose, and we would like it tightened up to look more like a dispute resolution process. But it is important to have something like this in the IGA. So if we were to go through the IGAs, you would see that I covered almost everything except for some of the more legalese. I'm happy to talk through any of those if you would like, and Kevin is here, he's had his eyes on it. So what's next? By May 1st, so this Friday, our initial feedback and comments are due to the county. So Kevin has had his eyes on it, like I said. Information Services, Bates has comments. Our risk management team has looked at it. Subject matter expert review, Jerry Ann looked at it. We've had others in the library with eyes on it. Your comments will be included in that. We have 2 opportunities for additional work sessions if we need, and we can talk through that more. On May 12th, the board is looking at it again and to discuss our feedback. And then on 26th, they are set to adopt the member recommendations and move forward with the signature process. And then on June 30, our current levy expires. I will say that and you may have questions about this, it is important that we sign an IGA. We do not want to be under the existing IGA or extend the existing IGA, the operating IGA, because the funding formula is so vastly different and is not in our best interest. So it is important that at least for the operating IGA and the governance IGA we don't have a ton of comments on the governance IGA. But anyway, the current levy expires June 30th, and in order to get the money under the new formula, funding allocation formula, we need to be a party to the agreement. I'm done. I'm sorry. I know that was so much detail.
But you have one more slide.
Oh, do I? Oh, yes, asks of council. Thank you. So this is an initial list. So advocate for sustained commitment from the county general fund to the WCCLS. There's people running for county commission. You have your connections. That is a super important aspect that the county continues to maintain their commitment to the general fund transfer. Also advocate that Washington County commit to maintaining community-focused local library collections, and then commit to involving us in annually determining the amount to be spent on collections at our library and input into how that money is broadly allocated among collection areas. And then reinforce the need for and the importance of strong communication and ongoing collaboration throughout the cooperative. That's our initial list.
All right, thanks.
All right.
All right, so I'll go ahead and open to the floor for public comments on the WCCLS draft governance agreements. So I have signed up. I have the Tualatin Library Foundation, Emily. And then after Emily, you do not have to be signed up. You can come on up if you're in the room or raise your hand in Zoom. And try to keep your comments to 3 to 5 minutes, please.
Well, it's a pleasure to be here this evening. My name is Emily Yonker, and my husband and I moved to the Tualatin area about 8 years ago for work purposes, and we have loved it and don't have any intention of going anywhere else anytime soon. I have been involved on the Tualatin Library Foundation Board, and I'm actually the treasurer, and I'm here to represent the board. We had a meeting last Thursday discussing this, and I have come prepared with a statement from our foundation. As a board, we are unanimously opposed to the Washington County Corporate Library Services Intergovernment Agreement as it currently stands. The libraries in Washington County are independent community and nonprofit libraries who contract with Washington County for certain services. We do not have a county library system, nor have the voters in the cities and service areas voted to create such a service or system. This IGA would remove the power to purchase the materials in all the libraries located in the Washington County from the individual community libraries and give that power to the WCCLS. While the IGA states that the individual libraries can provide input, The WCCLS can ignore that input or just go along with a couple of other libraries and what they want and not what Tualatin wants. We believe that we should retain the community-focused local library collections within the community and not let a committee of county members who don't spend any time getting to know us or our needs make those decisions. The IGA would take away our choice of what is or is not on our shelves. However, it doesn't take away the accountability. As a community library, the city retains accountability in any dispute, and we shouldn't have to defend choices made by the county. We as the Library Foundation appreciate the connectivity that is provided by being a county library within Washington County. There is great benefit in having the interlibrary lending options so that we can access all of the materials. But we believe it is in our community's best interest to retain as much control of the library as possible without the county overreaching into areas of our community. This is our library in our community and should remain under our control as much as possible. Thank you.
Thank you. Anyone else in the room would like to provide comment? I'm not seeing any hands. Is there anyone in Zoom, Nicole? Those folks in Zoom, this is your opportunity to raise your hand. I'll give you another shot, just in case. I've seen hands go up. All right. With that, we'll move on to the barrage of questions for Sherilyn and or our city attorney, because I know I've got some. But I'll open it to the floor first for questions, comments, discussion. Councilor Gonzalez.
I'm going to go with comments, okay? I know that when we met initially and talked about this, we knew that we're almost tied. We have to almost do this. We cannot fund our own library as Tualatin can, so it sucks. This organizational chart that was displayed is just so arduous. It reminds me of the state's general fund, that when there is issues with not funding police or fire or sometimes schools, because the general fund isn't properly funded, then we are going to be in a bad position. And this just adds one more service under that general fund. I know it's a local general fund and the WCCL has been properly funded based on what you said, but it is a thick bureaucracy. You know, before this had happened, Tualatin at one time maybe funded its own library, but now we really truly need to think about fundraising and having our own money just to meet the gap. Because, you know, when the general fund gets stressed for whatever reason, we will suffer. And I hate to say it because it's very cynical. I understand that, but government has a bad track record. So, and here we are, going to be part of that big pool of money. I really wish that this meeting could have been broken up in two, because this was a lot of information. And we could have come prepared, but I know that this needs to be signed, and if I had a vote right now, I'm going to say no in me, and that's not what we're asking right now, but I am really concerned about this, that we're going to lose our local control, and we're going to be having to go talk to a council person and advocate for them for what? Just to fund our minimum requirements that we need for our constituents. So this is just, to me, a bad situation. But I understand it, and that's a bad situation.
Others. Councilor Sacco.
I have a long list, I'm sorry. But, so in the chart that breaks down what everybody gets, I'm sorry, I should know this, but so the 17 million that goes to WCCLS, what all does that pay for? Like in broad strokes, not in detail.
It pays for all of the stuff that they, that is in the operating agreement that they provide. So, hang on. In section 10. So it includes collection. courier service,
Okay.
which includes like physical sites and all of the things that go into the equipment, the reciprocal borrowing agreements, the entire network. Yes.
Okay. Just out of curiosity, how many salaries does that pay for?
How many salaries does WCCLS have? I don't know. Maybe.
Sorry, I could get that, but it's a fairly thin organization.
Okay. Okay. All right. Thank you.
Yeah. We can find that out.
Okay. Okay. Thank you.
I should say a lot of that is. You can go to the mic. Sorry, yeah. Charlene, if it's okay.
Yeah.
That amount is not only, spent within WCCLS, a lot of it is redistributed among the member libraries. So that's not just internal spending for them.
Okay, so is that then in addition to that, like, because in that chart, there was like, list all the cities and then 17 million WCCLS. And so, I guess, is more of that distributed out then?
The 17 million is WCCLS's budget, but that also includes the reserve.
Okay.
And it includes their salary, it includes the physical sites, it includes the courier service, it includes collection, and all of the information network.
Okay. So it includes collection. So how, going to this idea of, the centralized collection, and then we would retain some, of our own local collection. What percentage would we then retain as our own local collection? And how is that funding different between the centralized collection and the local collection?
That is yet to be determined, but the 17 million does include funding for a consolidated collection. So they do the collection development, they would buy the materials, and hopefully with our input, and that's what we're fighting for. But and then the amounts for every city, we can spend that as we determine.
Okay.
So if we want to spend it on some local collection, we can.
Okay.
I believe.
We are still in that, all the libraries have had their meetings with the consultants. We are still waiting to hear their recommendations, but we have, in our conversations with them, we have heard that they understand that there are a lot of individual concerns at each library. We don't all do things the same way.
Right.
And so July 1st of 2027, all the things that we still own that we purchased are still ours. If there are things being purchased cooperatively that are from the cooperative that become, part of what's available on our shelves, the ownership right now is WCCLS, but they still haven't worked out mechanisms like what happens with deaccession and what happens with those items, who makes those determinations. There's a lot of unanswered things to be worked out in the plans.
Okay, that's good. And so the work that the foundation does all that work stay within Tualatin still, 100%?
There's been no mention of local support groups having to allocate centrally.
Okay, perfect. Yeah, as it relates to the collection and what they purchased. Okay, thank you. So with this new agreement, are we going to see fewer open hours, and will our service levels decrease?
Absolutely not.
Okay. What reassurance do we have?
I mean, it's part of our budget process. It's like our like, that's what we're funding. We're funding the hours, we're funding the services, like,
Okay.
you'll see it in the budget committee meetings and like,
So if anybody had any questions, and those budget committee meetings are coming up
Yes.
in May.
Yes.
And they're able to attend.
yes.
Yeah, I want to, can I dovetail to your
Yeah.
question? So, when we alluded to the general fund transfer, say the county's expectations doesn't meet reality of what's going to happen that year, they decrease the general fund transfer, we would then have to make it up out of our budget to keep the library whole, correct?
Presumably, yes.
We take the hit for them to keep our hours and keep our library open.
If we take a cut in our
Yeah.
distribution, from our $2 million distribution, and so we have a $2.9 million budget in the library this year, and we got less than 2 million from the county, we would have to find a way to
Yeah.
make that up.
Yeah, so, back to your Counselor Suck, I just want to make that point.
Yeah, thank
Yeah.
you. So going back to the biggest risk that you mentioned, projected county general fund transfers are determined through the county's annual budget process. So, so how do we mitigate those risks? And besides just advocacy, I mean, what other steps can we take?
I do not have an answer for that. I do not have an answer for that. They have been very clear that they will not put a guarantee into the IGA, other than year one.
Okay, I'll have to think about that for a second. So you mentioned that there was conversation about bringing up weighted votes. That seems a little bit. I guess I don't want to say that anybody has poor intentions, but I guess just in any context, it seems a little bit like a power grab, where if you have more, if you're bigger and you want more say, and then that, you know, and so I understand that that's not what was written in, but is there anything in the details that maybe we didn't see that would cause pause, that there are, that maybe the bigger cities are getting more than bargained for, or any sort of, I guess, risk with any larger cities taking more, having more of a power grab in with the way that the language is written today, that isn't, I guess, in our face, that we wouldn't necessarily see.
Not from Tualatin's perspective. I think that is not, so there have been issues between Beaverton and Aloha. That is the primary area that has been challenging of who's responsible for what areas, and that service area. And Aloha has been very frustrated through this process. But none of those impact Tualatin. Any grabs, I mean, we've had good conversations with Tigard about Durham. We've had good conversations with Sherwood about the Basalt Creek area, very collaborative discussions. And I mean, at the end of the day, you know, is it a risk that the bigger libraries, I mean, they have their own arguments that they provide many more resources, and that there's a reason why they're big, and that they should get more. But I think the language protects that one vote.
Okay. I have two more for now. So the boundaries. So if I understand this correctly, previous to this agreement, were we funded by the boundary?
No.
And now we are funded
Yeah.
by the boundary. And I saw the math, of course, but, so is our boundary, does that include our Clackamas County or it includes all of our Tualatin
Yes.
folks?
Yes.
Okay. And, I guess I'm just concerned about, I think Councilor Brooks said it earlier, people coming in, I know that's with every city. However, you know, just it's concerning that, you know, how that's going to play out as far as how many visits and all of those things, and are we really getting funded to the level that we need to be funded?
So when the consultant did an extensive like equity analysis of that took into account a lot of different factors, and ultimately it was super unclear, and it skewed the numbers, and like it just became overburdened, and so we all went back to, this is the simplest, clearest, cleanest for most, and preserves it has a symbolism of, I mean, it's defensible.
My last question, and this is just a clarification. So there was a mention of the funds couldn't be used for the actual buildings. Is that a change, or is that just, that's how it's
No,
always
that's
been?
always been how
Okay.
it's been.
All right. I think that's it for now.
Great. Councilor Hilliard.
Thank you. I'll try not to duplicate anything. So I think on page 13, you had a list of things in the, what was it, the operating or the, sorry, one of the agreements, yeah, the operating. And so I'm curious, what's the timeline to get answers on those questions? As far as, sorry, I kind of got out of there, sorry. Let me pop back over there. Page 13, I think it was. You had said we're advocating in the collection project for timeline adjustment and flexibility as needed, the phased rollout as appropriate, a system that allows for some local collection ownership, a community-focused collection as informed by our staff and patrons, and involvement in what is spent on collections at member libraries and input into how that money is broadly allocated among collection areas. So do we have a timeline for those answers? I mean, like, is it before June 30th?
Of this year? No.
Well, so what the heck, right?
I mean, we're in the process of, we're in this centralization, collection centralization project that is not it's not gonna be like turned on until July 1st, 27. So like, we've got a year and more to go. But the funding, that list of funding that goes into effect on July 1st
Right.
is based on, it takes into account the savings that are anticipated.
So these $2 million a year, right? The $2 million a year savings, but yet we still don't have answers about any local control for that, even when we sign it. Because, I think it's evident we have to sign it. I think it's certainly an onus on us to advocate in a whole lot of ways. Because, I remember Commissioner Treese sitting here and talking about the cost of the digital collection, all these different things. And it's like, well, I sure wish there'd been a little more transparency at that moment. Or maybe they didn't know. I think it's possible that, when you have consultants, they uncover different things. And I understand that, but I'm just not sure it's in the best interests of our community. But anyway, so we've talked about this, the savings, like if Beaverton has the satellite one, they get their allocation, they close the satellite one, they still get to keep the money. Well, so do you think that clause is an advantage or a disadvantage? Like
Well,
if we decide to shut something down and we just keep the money, do we shift it or?
They have to keep one.
Right, but there were other examples of if you take an FTE, I thought maybe you'd said Tigard was shifting something and they kept money. And they
Oh,
just,
that's with the centralization project, so,
sorry,
I'm sorry.
confused.
I-
No,
I know
I'm
it's
probably
confusing.
confused. I'm so sorry.
With the centralization project, whatever savings we find locally, by shifting collection development to the county, we get to keep those savings. So the county will now be funding the purchase of the materials, where we have 210,000 in our budget to fund materials. So we technically, like, that's going, the responsibility and the county is budgeting for that, but we have it in our budget. So we could technically use it for something else.
Sure. So when you say our budget, is that the money that when we as council, when we as the community go through the Tualatin city budget that we allocate to the library? It's not,
Yes.
so it's not what they're giving us.
It's all kind of mixed up together. But like our library budget is made up of our general fund contribution and the county, the WCCLS transfer, as well as Clackamas County transfer. So
Those braided funds are fun, aren't they?
But
Yeah.
that's all part of our general fund. But yes, you council ultimately decide the library budget.
Okay, so you think it's an advantage, that is acceptable? That stands out to me as a concern. And maybe I just am, it's because I'm not understanding the process as well. But that's okay, I can continue to learn more. And I fully agree that you need to push for some sort of resolution clause in there. I think that even with the best partners, clearly it sounds like Wilsonville and Sherwood are being great partners with us for all things, but there needs to be some sort of, yeah, I'm concerned about that. It's enough, thanks.
Okay. Okay, Councilor Reyes.
Thank you, Sherlyn, and team from the library. Just comments and maybe a few questions of clarification so I can understand. I really believe our library, I've been to several of these libraries. I visit them, just like Hillsborough and Beaverton. I feel that our library is very robust. There's always people there. I'm not discrediting. Maybe I go on the wrong time because I'm in that area a lot, but it's not as robust. And there's like ours, and I go based on what I see. If I see a lot of people, I'm like, whoa, something's going on here. When you mentioned something that there's gonna be a lot of commissioners running or a lot of that going on. And I know you mentioned the manager and library manager, director sit on these commissioning boards. Is that was that the role of our library director to sit on that board of the commissioners that are making decisions, the decision makers? Do you sit on that?
So I sit on the executive board, and the library director sits on the library leadership group.
And you are making decisions as well when they propose to say, we want to add a LOA into this coalition, you get to say so, or you get to vote on that, or is that kind of like?
Not that decision, that is a Board of County Commissioners decision.
Right, but I'm wondering who are these ultimate oversight? Is that Commissioner Snyder? I mean, like who?
Oh,
And then
yeah.
And who
Yeah.
else? What other commissioner? Like the Clackamas, like
No,
just him?
Just Washington County
No,
Commission.
all 5 commissioners. the Board of Commissioners.
So Schneider, okay, can we say their names?
Catherine Harrington.
Harrington?
Jerry Lilly, Nafisa Fye, Pam Trees, and Jason Snyder.
So they make decisions for all the libraries within our,
Yes, and they're trying to take more control over it.
right, I understand that they're trying to control, but like I thought so no one's representing us in that, like they don't have like representations of city, and I'm just trying to understand the governance and decision makers and people that decide who joins the WCCLS group. Like I know that Aloha was added, I know Something Plains was added, then they weren't part of they're not a city, they're not established, they're not like, I remember this, I don't know if I'm correct, if I'm wrong.
You're right.
But I remember that was part of that we were talking about, that they were gonna get a portion of money or funds from this coalition, even though they weren't part of they were not established cities.
Right, there's 3 nonprofits. Libraries.
Cedar Hills was the other one.
Cedar Mill,
Oh,
Garden Home, and Aloha.
Okay. So I just want to make sure that I'm clear, because I wanted to because I will speak up, and I know that, so you said if you can speak up in advocacy I will do that, because it's not fair, like we were talking about that. It seems to me that it's not fair, obviously. That was one clarification of decision-making. I saw Beaverton twice. Is that on the map that you showed?
Yes, they have 2 locations. They have a branch. They have their main library and then a branch library.
In the branch. And they're closing one?
No, they're
No?
not closing anything.
And they're still getting funds?
It's based on service area. And so their service area, and then every city gets to choose how they serve their area. So Beaverton has chosen to have a branch library, but they get the same amount of money for that service area.
Okay, so it's not like they're getting a portion and then
Extra
the other
money
one.
for the
Okay.
branch, no.
All right, thank you. All right, just, like I say, clarification, because there's not a lot
There's not a lot of clarification.
for me, as far as decision makers and governance. And then if I can go and advocate, because we need to, it sucks. And if we get to that point where if we get to that point where those $2 million are decided, that the $2 million that we're getting from the county are decided to be cut, that's gonna be the problem, right? And we still don't know where we're gonna get that, if that happens.
And it wouldn't be the full 2 million, because like I mentioned, the levy is separate, that we're gonna get that. And so that's 55% of the total. And the 45% is the county general fund commitment. So that's what's, technically at risk.
At risk.
Is what the county general fund puts into it. But 55% of it, which I'm not saying that if the county took away the full general fund support, we're left with 45%.
45%.
That wouldn't, we would have a terrible time.
Right. Thank you. I hope our city people out there are listening and choose wisely in November or whenever we're voting. Thank you.
Who wants to go first between you and Council Brooks? I know Council Brooks. All right.
Thanks. I don't understand how the population is determined exactly. So I think it would be good for us to have the numbers of what our city is losing and gaining compared to the other cities. Some of the concerns that I have in situations like this is that we'll do a really good job scrimping and saving on programs, and then less efficient programs get funded from efficient programs until the efficient programs break, and then everything is terrible. And I've been in libraries across the country that look underfunded by looking at them and by being in them, because they can't really afford to be keeping them up, you know? So I think it's really great that we have a foundation. And I guess we're fortunate too that we have a small percentage from Clackamas County. I don't really know the choice points exactly because we have a testimony that has a unanimous vote to not sign this. And I imagine they're smart people. So I don't know where we would, I don't know what like if we didn't sign, what money we have, what gaps, and how important it is to our community to have our own collection. Like, is it GoFundMe important for the library? Like, I don't know all these answers right now. I do think that them releasing this at this short of a timeline is pretty bad. I am curious if Commissioner Schneider has shown up to any Library Foundation meetings or concerned citizens meetings at our library about these questions. And I think that, you know, that open house type of a thing with whoever, we can invite all of them to the community to ask these questions, because this is a very, I mean, we're losing, and then I'm just going to speak to like the elephant in the room too, like commitment, professionalism, et cetera, of long-term employees. That's hard to put a price tag on. We're already losing in this moment, in my opinion, and it's something sideways about this whole conversation, and I don't feel clear enough on this conversation right now about what our choices actually are, and exactly what the community thinks about this in this moment. And I don't want to be, I'm also irritated because I feel like there's been several times now where our community is like the side hustle of the county, frankly. And when something's not working out at the county, somehow we're getting the short end of the stick. I don't know why exactly that's going on, but I think that advocacy is really important. I'm not ready to be saying I'm doing anything for this agreement until there's some answers that we have to the questions that you've raised about having our own collection, about what determines this particular thing, what this budget shortfall has to do with this overall numbers that we're dealing with. There's so much vagary, and it'd be different if, you know, like we didn't just get STIP programs just thrown on our list without ever even being told about it. So I'm at the point where I don't trust them to follow their word. And it seems to be getting more complicated by the day. And the biggest concern I have is doing really, really good work, people doing really, really good work. And instead of being rewarded for it, you get penalized for it by supporting things that might not be as efficient and effective. So those are my concerns right now. It's not really a question, I guess, but there's too many questions on this for me. Like, this is, I don't think I've ever had a presentation like this here. Thanks.
Council President Pratt.
All right.
Okay, so it's been a while since we got a presentation, and the last one we got, I'm just trying to clarify, like, this allocation, because it showed a law getting this huge amount, blah-de-blah. So are you saying that now the whole allocation is based just on this service area that they've determined? The formula is based just on our determined service area, is that correct, or we're?
No, it's service area and then FTE units and then cost per unit. All those things go into.
So how did they determine FTE units?
It is a factor of the service population.
So it's the same thing, essentially, they're just. Okay, that's okay, we don't have to go into that detail, but it's more just based on that, what you showed tonight.
It's what it cost to, an average cost to serve the population for the base service level.
But it was looked at just where they determined a service area, not, like, I know there's a lot of Lake Oswego people that come to our library. We just serviced a ton of people from Tigard, so the actual use wasn't taken into consideration.
Right.
Okay.
Right.
So that seems a little inequitable there, but okay, they came up with a formula. When Commissioner Snyder and Commissioner Treese were here, so what happened is there, like you showed that money, there was an old levy, then ballot measure 50, it went in the general fund and they allocated it to 3 years ago? And then all of a sudden they took some of that money because they were short. And then they passed this levy, which had a huge increase in it. So, okay, we'll be guaranteed that levy money. But when they were here, they were very clear that they would not say they were going to, that general fund money wouldn't be dipped into further. So I have a huge concern about that. I mean, they didn't even say they'd try not to. So it seems likely that will be the outcome in future years. I'm not understanding why the big rush to allocate this money when the savings can't come until the service starts in 27. So that's confusing to me. Like, why do we have to sign this IGA now when there's all these, we don't even know how it's going to work?
Well, we don't know how all the collection centralization piece will work, but the levy expires on June 30th.
Right.
And so we need to be in a new IGA to allocate the levy funding.
So is that all we really need to do? Because we're being asked to sign something that's not clear. It's just, I don't know how we can do that.
I mean,
it's like, sign this unknown thing. With no parameters.
It's not an unknown thing. It's like the centralization project is, there are questions about that, but that is a piece of it.
Well, like on the other part with the voting and stuff, though, it seems like, from my understanding, the process so far, like, your executive committee should have had votes and input, but it doesn't seem like that's necessarily what happened, and that input was not collected. I mean, I'm not hearing anything about any community outreach on this, other than they came and maybe talked to the councils once. I mean, it's like, it's the whole thing, we fight it with the state where they just say, boom, you're doing this, and then and on the uniqueness, I think you sent something that there was a survey, and a large percentage of the people, the uniqueness, and we hear this on the CAC, the uniqueness of our community is very important to our community, and this is taking it away.
I would push back on that it's taking that away. The centralization project has some unknowns that we will continue to fight for. But the IGA as a whole, the operating IGA and the governance IGA is much more clear than what we're currently under. The decision-making process is much more clear than what we're under. Like, yeah.
Okay, on the operating one then, is there I guess I would ask that if that decision-making process isn't followed as it should be, what's a way to deal with that?
That is a
question.
great question, and what's in the accountability, in the accountability section right now, it describes a process for raising that issue. We think there should be a stronger dispute resolution process.
Right.
Yeah.
Okay. And then back to I'll go to the collections. I'm trying to get through this. What concerns me, I guess, and I get some of the centralization of the, the fiction and things that every library would want. But it seems so unclear if we have any autonomy to get the books that are, like, our community probably wants different books than banks would generally want. We probably want less books on agricultural things. And so I'm concerned about that. I'm concerned about our collection of things, our maker space. Like, what is getting taken away from us there?
We don't know yet.
So once again, we're being asked to agree to what we don't know.
So far, what seems to be on the table, the Makerspace is a program. It is not a collection, and so that is not.
That's part of our library operations. Okay.
But yes, we have a library of things. Some libraries do, some libraries don't. We have the best board game collection in the county. We have some other unique things. We don't. We believe there will. That centralization won't touch those, and it will be up to us to decide that is something we're going to continue. That's still a TBA because the process has not been set out. But
because we own all of that now. We own that.
I know,
That's
but
not
I
being
mean,
transferred to the county.
I know, but adding to that collection, is that something we still have the autonomy to do?
We believe so, yes.
we can. My understanding is the budget we have, we can determine what we are doing with it. It's the mechanism.
Okay.
We don't know how deep they're going with the centralization yet.
Okay.
We believe we'll still have some ability to have some local decisions.
Okay. And then I know it started out with centralization was going to be cost saving, but then somewhere along the line I read something that isn't necessarily the case. So do we know it's going to save money?
I have not ground truthed that.
Okay.
There was an effort to understand what all of the libraries were investing in collection development. And so like 9 employees here and 6 employees there and 4 employees here. And if the county is hiring like a certain number, let's say 5, to do all the work of that was happening
At the
independently at all these libraries.
But they're taking funds to do that.
And that's part of their 17 million.
Right,
yes.
okay. I guess I'll just get to the bottom line here. Like, if it's so unclear, but what are the ramifications if we don't sign these? Because this is really hard to say yes to something that is like a muddle.
We don't get the funds.
Come on, kid.
Sorry, but that's the bottom line, this is,
From what I'm hearing, that's what it appears. I reviewed both of these. I have a bunch of questions for, a lot of it are legal terminology, things like the indemnification clauses and the governing and operating agreements. They're substantially different, and they should be substantially similar, if not the same. I understand they might be a little different. There's one big problem I see in here potentially. I did note the lack of a dispute resolution process. In the operating agreement, there is it looks like in 17.4, there's a cooperative process for addressing issues. But it's a little vague if a contractor can't meet obligations under the agreement, or they have an issue with cooperative-wide policies. But I didn't see that addressed if there was a alleged breach of contract by a disagreement by a contractor. There's no dispute resolution process. Obviously, the big question about if the board decides they don't, at that 45%, they want to allocate substantially less than where we normally get. There's apparently not going to be a mediation process agreed to.
No.
I haven't talked to the county. I imagine that their reasoning would be that they have to follow budget law. They have to provide a balanced budget.
Right.
And having a contractor or contractors that could potentially subvert that and force them to divert funds to this when they didn't have it for other things. I would imagine they want to make those decisions, but I haven't spoken to anybody at the county. I haven't spoken to any of the other contractor attorneys or the county attorney. That seems like that might take a while. To have attorneys agree on anything, I don't know how many attorneys I'm even going to have to talk to.
This is true.
The process of having to look at this. But I think the biggest thing I see in the operating agreement, it's in section 18, it's the termination.
That's where I was going, is on that right there.
It's
So that's not that.
18.1, and I won't take up the whole time here, but the biggest issue, and I will want to speak about this, but it says the county may terminate this agreement effective the end of any fiscal year upon 60 days' notice if, in the county's sole and reasonable discretion, continuation of the agreement is not in the public interest or sufficient funds are not appropriated or otherwise available. So there's a non-appropriation clause, and then there's another, what looks to be this public interest, which is a termination, in my reading, a termination for convenience. So the county can terminate it for any or no reason.
their discretion.
I could read this as that the county has the ability to terminate it as to an individual contractor. That's one of the things we'll want to talk to. So if we had a contractor that was potentially a squeaky wheel, or an executive board that were squeaky wheels, could the county, using this language, terminate individual contractors, which chills potentially the leadership group or the executive board's recommending power, any kind of maybe cooperative process for addressing issues.
Yeah, it
It
sure
might be that a
seems to
contractor would
put
not
'em
want
over
to
a
bring
barrel.
up issues if potentially the county could just terminate your participation. And I'm not saying that is
No,
how
but-
it's been.
Well, that's what lawyers are
What was
supposed to do, look
intended.
for the worst-case scenario, right?
But there is clearly a termination for convenience clause that the county can terminate this agreement either as to all parties or individual contractors for any or no reason.
Okay.
And that's an issue
So-
because it affects contractors. The termination affects us much more than it affects the county.
And so the fact that our taxpayers are paying their property taxes and that library levy, they would just, it wouldn't matter, they would just be paying for everybody else at that point. Okay, so at this point, you're gonna take our recommendation, or will our comments be shared
Oh, yeah.
with the county, and then you'll come back to us
Yeah.
with whatever answers they may or may not give you? Okay. I guess
Yeah,
I'm
we'll put
done.
it on another agenda.
Okay, thank you, Sherwin.
Councilman Gonzalez.
Thank you. So, just to be clear, so we are the contractor, right? Walton will be the contractor. So we also can cancel in 60 days, providing the proper notices, but we're still out that money. We will still need that money to continue to fund. And if we're paying our taxes and we're not getting those dollars, because it even says here that even though this contractor cancels the contract, it does not affect the other contractors either. So they get to stay in and benefit from that pool of money.
I think that's the correct reading, Counselor.
Hilliard.
Thank you. So would you agree that that should also be in the other, outlined in the governance, in both agreements? Then it's lacking in both agreements, Counselor?
Are you talking about speaking to the termination
Yes,
language?
sorry, yes, I'm still on that
That's one
topic.
of the issues we'll have to discuss with the attorneys, whether
Okay.
that needs to be in there or not. There's several issues. I've brought up a few, but I do understand in the governance agreement, I understand the need for a supermajority for the executive board and the leadership group. That serves several purposes. One, if there are recommendations made to the ultimate decision maker here, and it is the board, the executive board and the leadership group, they essentially act as one of your boards or commission acts when they report to you, is you ultimately make decisions. They make recommendations. That's what these two groups do in these governing and operating agreements. The board makes the ultimate decisions. But the supermajority, it ensures that there's broad consensus among contractors and protects the minority view. So you don't have a group of 7 forcing or sending recommendations to the board as if you had broad consensus as to all 13. But there's one issue I noticed, and it may not really be an issue in all, is there's a pretty complex collective decision matrix that maybe we don't need, because I don't know what decisions the executive board or leadership group would make that weren't really considered collective decision requiring a 2/3 majority. And there's examples given in the addendum. So if you get to a meeting and maybe you have the argument on whether it's a collective decision or not, and do you have just a majority vote, or is a majority vote required, or do you have to have the supermajority? There's just issues like that that are outstanding.
Thank you, and I have one last follow-up to that. Do you see any places where there is any sort of recourse if the county, if WCCLS breaks any part of this contract? Is there anything glaring, or when you review it?
There is I think it's in the operating agreement. But, and again, it goes back to whether, I don't know whether 17.4, the cooperative process for addressing issues would be, was that the intended mechanism for things like that? If we allege a breach, there is no technical dispute resolution process. So given that this is an agreement, even though, again, and this is one of the things I will recommend, is have this attorney group is set out what our remedies are for breach. What constitutes a material breach versus just a run-of-the-mill breach that may not constitute further legal action. But given the lack of any dispute resolution or remedy for material breaches, I believe that technically there could be a potential for legal action to a circuit court.
Thank you very much.
Councilor Brooks.
There's also that part in that you're talking about, the collaborative thing with the escalation piece, that it would have to go to such and such before escalation. So I don't know what the definition of that is. And then the other thing is, if there was ever a falling out or they determined to just cancel the agreement with us, does that mean they keep our collection? Like, do we lose assets then? And, or is there, if it was 1 year into it versus 5 years into it? And my last question is, because it just seems very strange that we pushed and we helped get this levy passed, that there would be an agreement that we would be asked to participate in that puts our citizens at risk of losing their assets of their library, and the money that they put into this levy. So I don't know what it just seems like a very strange one-way kind of a thing.
I don't believe that's the risk.
I mean, the risk is also the millions of dollars, but I mean, if you can terminate a contract because of a random, I don't feel like I would have these conversations if it was maybe a while ago, but I have less trust for the county than I used to, unfortunately.
And that's a fair question, Counselor. I don't think that if this agreement was terminated by either us or the county, that they would have access to the collections that we had purchased with city funds. I don't think that would necessarily be the issue. And I will state that this is an intergovernmental agreement. This is not a contract with a private party. there is an expectation when you're entering into intergovernmental agreements of good faith, fair dealing, being reasonable with one another. We have, as you know, many intergovernmental agreements with other local governments, cities, counties, and that's rule number one is you don't attempt to take advantage of another governmental entity because there are other agreements out there and that potentially could be affected by bad faith interactions in one of these other agreements.
I will just say again, I think that community outreach would mitigate a lot of these problems if they would have done due diligence. We would never do something like this without community outreach. Even if there was things that we couldn't bridge, there's a piece about people not being able to come to their government right now and influence how their government works that is a big conversation in our communities. And it feels very like authoritarian and not approachable and like the small guy getting left out. So I just feel very disappointed that they haven't come to our community to talk about this more, especially since they asked for our support with the levy and kind of said they would do right by us. So I'm just saying it out loud.
I agree with Councilor Brooks. I think that we went out there in good faith, trusting that they're gonna support us and give us the funds that we need to operate. And we went out there and told our community to vote to pass this levy. And here we are in this situation that there's a risk of them deciding based on this projected county general fund transfers are determined through the county's annual budget process. So that, I just hope that that also is also on their part, they're not breaching, but be accountable for and in good faith of what they came here and talked about, at least that one meeting that Commissioner Snyder came and talked about it. So I hope that by signing this agreement or IGM with all those questions that we have and all, clarification, they honor that they would not cut any funds from us, that they would support us in all of our programs that we, not programs, but in whatever, in the things that they fund us. I hope that we're not thinking of, that they're not gonna come through with this. I really hope that what they said they were gonna do and support us, with the agreement, comes through. That's kind of like what I'm thinking.
Mm-hmm.
And that it was in good faith. And we all went out there and rooted for that, and here we are in this situation.
Jeez, all right.
I'm done.
I'm just wondering, I know that's a legal term in good faith, and I mean, from our lay perspective, that's where our problem lies. We don't know that they're going into this with good faith because they haven't been a trusting partner to us. So what does good faith mean in the legal sense of the term?
They have been a trusted partner.
But
they have been a trusted partner.
But they're saying we're gonna do this and you can take it or have no money. That's
But
what we're hearing.
You were saying that they have not been a trusted partner. They have come through, even when they have had budget cuts, they have increased our allocation. They have made a commitment they have. They have been a funding partner for us.
Well, they have been a funding partner. I'm just saying that it feels like we're being dictated to, I guess, is my point.
I would say that there are many things in this agreement that we advocated for, and that we advocated for clarity on roles and responsibilities, and that these IGAs are full of things that are in our best interest. That there are risks, absolutely. There are unanswered questions, absolutely. There are things that need to be tightened up. But this is not, I do not believe and that they are trying to pull the wool over our eyes on this.
But, okay, that's good to know. There's so many unanswered questions that we don't know that at this
About the
point.
centralization process. But and maybe that is just an overwhelming, like, we can't get past that. But that is a minor piece that is a portion, a component of these IGAs.
I get that, but it's just, it's hard that we're supposed to be partners in this, but we're being told to sign, it's like, oh, just trust me kind of thing. And that's, I feel like it's hard for us to feel like we're being real responsible to our community when we're being asked to sign onto something with so many unknowns. That's what's really tough here.
You get it?
Done? All right, because I got pages here, so be ready. All right. I'll start off with questions for Kevin. 6.2.1.2, the definition of centralized collections is to be a collaborative process. Where is that defined in the agreement? And this is in the cooperative governance agreement. What is collaborative process? Because what I'm hearing from library staff, it has not been a collaborative process.
What was the reference again?
6.2.1.2 of the cooperative governance agreement. It's the only mention of centralized collections in the governance agreement. It just mattered to me usually you have definitions, and I'm not seeing a definition of what collaborative process is, given you're hearing here that there's a mistrust of the county in a collaborative process.
Mayor, I don't see that
Are you not required
definition.
for that? Is that not required in an IGA?
I don't believe that they think so. I believe that they think in intergovernmental agreements that that's inherent in any intergovernmental agreement, is that we work in good faith to collaborate and to effectuate the terms of the agreement and to resolve disputes amicably. But I agree that that term is not defined.
Okay. Moving on to the role of the WCCLS manager, and that's section 6.2.3. So my question here is, it's 6231 through 6235. The WCCLS manager, based on what I'm reading here, cannot dictate policy to the executive committee nor the expertise committee. They can suggest something, but they cannot dictate or perform as an administrator of the cooperative. That the cooperative itself is supposed to be running policy and services. My fear here of getting to here is that the WCCLS manager can take on a role that I don't envision isn't appropriate in a cooperative, that the cooperative executive committee are the ones who are supposed to be driving the train, kind of like we were doing with you, Sherilyn, that the city council drives policy and drives a lot of things, and it's your job to enact it. Same thing with the WCCLS manager, that the executive team, the executive board and the leadership group is filling that role, and that manager is not to be setting policy, defining services or creating services and pushing it down.
Correct.
Do I have that right?
Correct.
And is that what, because I'm seeing nothing here in 6.2.3 that gives the library, the WCCLS library manager those powers?
Correct.
Okay. Because the impression I have now is that the current one is doing that.
Mayor, I agree with Sherilyn. That's how I'm reading it. I haven't, this is my second reading of that particular provision, but yes, I do agree that's the most plausible reading of it.
Okay.
Again, in these meetings we have with the county and the other contractors is to ensure that that's the case. If that has been an issue in the past, we can ensure that is the role of this WCCLS manager and not take on any more, or usurp the power of the executive board.
Okay.
We'll
thank
also say that that was not defined at all in the current agreement.
Okay. This is definitely for Kevin. Item number 10, interpretation. What the hell is that paragraph? Number 10 of the cooperative governance agreement on how to interpret the agreement. Yeah, I'm not a lawyer, but I'm reading this going, what are you talking about? It's a bunch of fluff. I'm like, what are you talking about?
Yeah, this is standard, this goes back to the working in good faith. With
So
one
you're
another as
okay
part
with
of
this
the-
paragraph?
We see this in, maybe not all intergovernmental agreements, but I've seen this in a lot. And so if there were a dispute about what a particular provision means, is that, well, it says liberally construed in accordance with the general purposes of the agreement. So you'd go back to the witnesseth statements, the whereas sections, and that would be potentially a way for the parties to come to some mutual resolution. And for some reason, like I said, there is no dispute resolution clause. If there were a court or some other trier fact involved, they might look at this interpretation language that everybody agrees they had the opportunity to have attorneys look at it, so they're not at some disadvantage. And then, yeah, any ambiguities with respect to any provision of this agreement will be construed fairly as to all parties. So that goes back to the good faith and fair dealing. How much weight would a trier fact give that? I'm not sure. It could come into play if there was some honest disagreement to the parties, or there was some provision that was so vague or overbroad that it was impossible for the parties to potentially resolve the issue. Is that would be a potential mechanism.
All right. I just want a clarification on that one. Sherilyn, going back to your centralized collections, that the consultant would be listening to the cooperative members about a possible delay in the 2027 deadline, but you mentioned someone would decide to do that, and would that be the board? Who decides that, okay, you know what, we're gonna push pause on centralized collections for another year? Who makes that decision? Is it the board? Or is it the executive committee? Who makes that? I mean, if you guys decide, hey, you know, we're not gonna make this, and we need to punt this, who ultimately makes that decision? That was my question.
It might eventually get to the board, but right now, it is a project of WCCLS and the Library Leadership Group, and the member libraries. So like, the consultant is the lead, and we're all working together to implement it. So if it gets to a point where everybody understands that it can't be fully implemented by July of '27.
At least two-thirds.
That goes through the decision-making structure of starting with the Library Leadership Group, who are involved with it right now.
Yeah, and Mayor, I agree. If that's determined to be a collective decision, it would go through the two-thirds supermajority with the board ultimately making the actual decision.
Okay.
Final decision.
12.6, public spaces.
That's the operating.
Ultimate control of our library, the facility itself. I just want clarity that the county can't dictate to us the use of our facility. I mean, there's certain things, minimum operating hours, stuff like that, I understand. But could they, I'm again being worst case scenario, invoke some kind of restriction or something in our public space that we don't like and don't want to happen in our library, but two-thirds of the majority of the cooperative says yes, that it's in opposition to what us as city councilors want for our library? I'm just kind of a little nervous at how much say the cooperative has on the public space in our library. And again, for Kevin, is it defined well enough for you in this agreement?
Upon initial review, I don't believe that the county would have that ultimate authority to determine how we use our public spaces. I think it gives it has requirements, and those are specifically set out. That's what control, I guess you would call it, the county potentially could have over the library, but nothing else. That seems like those kind of questions would be local decisions.
Yes.
And that would be solely within the power of, if it's day-to-day operations, the manager or designate.
I just had the same note you already picked up on, already 17.4, cooperative process for addressing issues. It needs clarification, but you guys already addressed that you are going to seek better clarity on how to address issues. The termination, I also had an issue, I underlined, I was showing Maria, that, in the county's sole and reasonable discretion, that's crap. Sorry. That's if you're going to kick a contract to the curb just because they piss you off, I'm sorry I'm saying these words, that's not right. And that's sole and the reasonable discretion, how do you define that legally?
Well, and again, Mayor, how I define that acts as a termination for convenience in the county's favor. And perhaps they did not really realize what they were drafting, but that's exactly how I'm reading it, is that, again, for all the reasons stated, it acts as a termination for convenience for any or no reason. I would also separate that non-appropriations clause, which I do understand why they have that in there, given the 45%, and they'll determine how much of that goes to each contractor. I understand that. But those need to be separated out, in my opinion. I think that hopefully a few attorneys agree with me on that. And rework that language, definitely. I would not want to see a termination for convenience in a contract like this. We have other termination clauses that provide, there's mutual terminations that we can, obviously we would be okay with. But if there's going to be a termination where the county has the upper hand, I would want to see it be for a breach, a material breach of the agreement. And if we're going to have that, have a dispute resolution / arbitration clause, so we're not kicked out of this agreement and then lose 45% of our funding potentially.
Yeah, because part of my note here is in the breach process, that to me, city council has the ultimate authority on our library, and I am not giving up, or the future city council is not going to give up any kind of authority to an administrative board of this library cooperative. That it's our library, we get to run it. Yes, we abide by the cooperative collective decisions, but if we have a dispute with a certain item, that they don't have the ability to say, you know what, we're going to take a ball and go home because we don't agree with your city council, and it's basically a match between us and the Board of Commissioners.
Mayor, I understand what you're saying, because I redlined that too when I saw it. And again, I don't believe that Washington County, when they drafted that, that's what they intend to do. What I've seen with every local government that we work with for intergovernmental agreements, we may not agree on everything, but there is an expectation, and the reality is there's good faith among these entities to make things work. We have many, many intergovernmental agreements with Washington County. I think that I'm hard pressed to find an instance, I've only been here 3 years, almost, that you can't work in good faith with a county attorney or a staff member. We try to resolve these issues before they become an issue for a governing body.
Moving on, and you alluded to it, or Sherilyn did, attachment A, the decision-making matrix.
Yeah.
What is this? I mean, so I understand the purpose of this. Okay, delineate what's a collective decision, what's a local library's decision, and what's the cooperative's decision. And it seems if you get to the bottom of the grid here, the WCCLS decisions are pretty darn limited what they have the authority to do.
You're right.
So basically, the local and collective should be running the show.
Yep.
Whereas the WCCLS, all they're going to be doing is money, resource allocation, running the network, the basic stuff, and they're not going to be doing the stuff. They're no longer making decisions on, and I don't get in the weeds with library policy, but the policies that are going to be created are all done locally through the collective and not the other way around.
This matrix is words that we want.
Okay.
It's making sure it's followed.
Yeah, it's just making sure. Yeah, sure.
The only thing about that matrix that I saw was that the roles are duplicated between two entities, so I don't understand who's doing what. Right?
Do you have an example?
One was budget.
On the matrix?
Yeah, one was budget, and it's been a while. Local budgeting. I thought it was, maybe it was a shorter one. I thought it was like budgeting and equipment. Local decisions and WCCLS decisions are the same decision-making, funding decisions.
No, thanks for bringing it up.
Right, because
Can't
that,
see it from here.
the WCCLS gets to make their own decision. The department of the county gets to make that, the budget and resource allocation, just like we get to make local budgeting and resource allocation for our.
For ours.
Yeah.
So I don't quite understand that, because it's sort of like, decisions affect other decisions. So if you're gonna, like, who's making the decision first or second, or how do you do that? If somebody's making a budgeting and resource allocation decision that affects everybody, and then you make your resource allocation decision that affects local,
I mean, that's the way it's happening now. That they have the ultimate,
yeah.
they have the budget and they tell us how much we have to spend and then we allocate.
And the way you do our thing, yeah, okay, so they go first, right? Is that how that goes? Okay, thanks.
All right.
No, the collective decision is the funding allocation
Yeah,
methodology
yeah.
and adjustments and cooperative-wide funding strategies. Like that, that is a collective decision. The WCCLS decision, a resource allocation decision would be whether to hire a management analyst in data collection,
Okay.
or whether to hire an administrative assistant,
Okay.
or like what they do with their local budget.
Okay. So
Okay.
the credit, this is something we want.
Yeah.
Because it's gonna, my words, better define what their role is versus the two other committees.
Absolutely.
I'm sorry, not the committees, the collective, the two committees plus the city council itself.
Absolutely.
Great. All right, moving on. Exhibit D, library funding allocation methodology. I'm not going into the weeds on this one. My question is this specifically for fiscal year 26, 27? Can they change this in the following year? Based on, and who has the ultimate authority on if they want to change the funding methodology in a future year? I know I'm putting you on the spot.
And it's part of the agreement, but this is the base year.
That's the base year?
This is year
So,
one.
Yeah. What about year two?
Is determined in that section, 16.3.1, adjusted annually based on the procedures outlined in 16.3.2. And it's that chart that.
Yeah. So, but the actual mechanics of if they wanted to change, like you're saying, the number FT, the 4.5 FT per 10,000.
No.
The 128, this is set.
It's all set in
Okay.
yes, the
All right.
formula
Yeah.
is set.
Okay.
Yeah, Mayor, if I understand, the the board could not unilaterally change.
Yeah, that's my
a
question,
specific provision of the agreement that we've all agreed to. That would not be a power that they would have unilaterally, and we would have to mutually agree to any amendments to this IGA.
All right. Getting there. So we're getting into the centralized collections right now. We've been hearing lots of concerns. Some of the emails I got are concerns about when they start making centralized purchases, that they also would have the ultimate authority about the format of the collection. They could go strictly all digital and ignore paper. How would that be handled? Again, you probably haven't gotten to it in the agreement on the type of materials they purchase. And if they go all in on digital, despite a community liking paper, is there any discussion about that yet?
Do you have any thoughts on that, Sarah?
It's just what the collection would be? Or is that not a concern?
The whole point of this is about a physical collection, because so far the split has been that WCCLS handles the digital and the member libraries are handling everything else, all the physical. The whole point of this project is the physical collection. I believe it's actually spelled out that it's physical collection.
So it has nothing to do with the digital part?
It has nothing to do with the digital part.
Okay, so it's all hand-on books, stuff like that?
Yeah.
Magazines? Okay.
We don't know yet. I mean, we don't know about every single bit of it.
I mean, yeah.
You know, personally, I think I'm watching a magazine fold about once a quarter.
Yep.
From publication, and how much time we have left with it,
Okay.
that format is left to be seen. But my understanding and all the discussions about centralized has been about physical formats.
Okay. And then, on that same tangent, when they're starting to do this centralized collections, we've always had the controversies over types of books that are purchased, LGBTQ plus kind of books, or books that are the community or a certain part of the community feels are inappropriate. The amount of materials you buy for foreign language speakers, has that been discussed in the centralized collections, and how is this going to be dealt with? Again, I don't want to put you in the spot.
It's known that that's part of the project.
Okay.
That each member library has their own collection development policy, and that we need some way that honors each of those. That's part of the collaborative work to come.
Okay. This came up before, so say, we're in year 5 of the agreement. Well, it's only a 5-year agreement anyway. Yep. We're in year 3, and we decide, we've had enough with the county, and we do want to terminate the agreement. The question I have is, on those items that were purchased by the county and are sitting on our shelves, do we have to give them up? Again, I know this is...
It's highly hypothetical.
Yeah.
So far, the only thing that's been talked about with disposition is if it's in your building, you can dispose of them the way you regularly would.
Okay.
Like for us, the Friends are great partners, our schools are great partners. My understanding is that's still going to be honored.
Okay.
This is so hypothetical that question hasn't been discussed.
I'm just, because I hate, one of the things they're going to hold over your head, okay, well, here, guess what? You leave us. We're going to come in and take a third of your brand-new collection away. I mean, we're all getting negative. I realize we're getting super negative and paranoid. But yeah, and that's not without good reason. Okay. And then my last one is going to Counselor Sacco's point about the power grab that the 4 big libraries are having a lot more say than the smaller libraries. I appreciate in the IGA that's one library, one vote, because it seems recently, these 4 big libraries had a lot more say, and were pushing their weight around and saying, suck it up, if you will, sorry, to the smaller libraries. I'm gonna be frank, and, about this, that, we're the big boys, you're the little ones, just total line, shut up, this is the way we want. And the one vote thing is super important, that there is no factored vote.
Yeah.
Okay.
Agreed.
All right, so my last point, and it's not a question, is we've talked about, hey, how do you talk to a Washington County Commissioner? You can talk to 3 candidates for Washington County Chair on the 29th, right here in Tualatin. There's a debate that the WEA is hosting at Perlo on the 29th, which is what, Wednesday? At 11:30 to 1, and you get to do Q&A with these chair candidates. I have registered, and I will love to ask a question. My only concern is they filter and vet the questions that they want to answer. But we can also put them on the spot when you get them in a corner of the room, and like 3 of us, it can't be 4 of us, talk to that person and ask them about this. So if you have an opportunity Wednesday at Perlo, lunch is included for the debate, this will be your opportunity to talk to the, potential chairs and see if you can squeeze any kind of commitment out of them or a promise about the general fund. Councilor Brooks.
Is the public invited to this?
All you gotta do is pay your $45. Yeah, you can go to WEA's website and you can register, and there's just a registration fee.
Okay.
Yep.
And pepper them with questions.
Oh, yeah. I think that's all mine. It's at Perlo, so it's easy peasy to get to.
Mike, can I say?
Go ahead.
I'm gonna be out of town on the 11th, so I don't know where the future of this, I know that we're looking for getting information back, but I thought we were also having our budget meeting on the 11th. I just really want to put in there that I think that, like all the other collaborative things that we do, like the roads and stuff, that there should be community outreach when this is going on for the rest of this process of like these, if we're going to have this moving collection, I think it's really important for the community to understand this better right now. And I think there's a gap here that makes this more difficult than it needs to be. And that I don't usually see I have complaints about the county right now, but they've always come out with their, a poster and a this and a that, and I haven't seen that.
And so the last thing I was just mention on your last slide here, Cheryl, the ASSA Council, based on what I heard tonight, we're in full support of the things you recommended here, and we'll do that on as much as we possibly can, and also ask you, as all the questions tonight are paranoia, if you will, passing that on at the next meeting, because I don't think we're going to be the only library. I know there's probably 1 or 2 other libraries that are a little bit skeptical, probably not as much as us. I know the big libraries are in a whole different position because they are looking to save money, and this is their Band-Aid to fill a budget gap, but we're not in that position, so I think we have to be a little bit more sensitive, but don't want to be the naysayer. I think it's just totally, I gotta use a better word, it's very upsetting that the library's schedule has just been miserably bad between the bond levy and all that stuff, that this has just been totally bungled by the county, and that we're waiting to the last minute to be given an IGA and given 2 weeks to vote on it once the commissioners have voted, or a week to sign it and say, sign it or, pass on the money. This could have been planned way better. And as the centralized collection discussion could have been started months ago and not still be dragging out, because it was no surprise that we're going to be doing this. It's just bad timing, bad project management. Another thing that we can be brought up to the Washington County Commissioners on, better, that, putting cities in this predicament is crap because of their lack of planning. Not just my statement, political statement, if you will. Anything else?
Can we ask for an extension to sign this? Because it needs to be signed by.
The money runs out. Yeah. They're waiting to the
Oh,
last
yeah,
minute.
they purposely did that, which is deceitful, and it's not cool. It's, But, you know, because of that, can we ask for like a state, like an extension to read it and be more careful on what we're signing and bring it to their attention, or is this it?
I mean, we've got until June 30th.
Oh, then we can still talk about this later.
We can talk about it, but will
Yeah,
something
but
happen?
we still need.
You're not signing it tonight.
No, no.
Okay,
Yeah.
good. So let's just, then, you know,
Fair enough,
clarify
yeah.
all that
Yeah.
and, yeah, because,
We'll be in conversations
Yep.
with the attorney group, with
Yep.
the county administration, and we will transmit, we've got comments that we're transmitting, we'll transmit your concerns and feedback, and we'll be back.
Okay. Appreciate the update. Thank you, Sarah.
Thank you, Sarah.
All right. So that brings, I think that's the appointment committee. There's one more thing. All right, item number 3, consideration of, yeah. Consideration of recommendations of the, yeah. Consideration of recommendations from the council committee on advisory appointments. You're gonna lead this,
Yeah.
Councilor Sacco?
Thank you. So we did have the CCAA a couple weeks ago on April 7th. I did want to mention that we did start minutes, which are posted. Thank you, Nicole. So feel free to review those. And we, of course, had more wonderful folks than we could appoint. But we have Anthony with the Budget Committee and Stephen with the Tualatin Arts Advisory Committee. And so I would like to make a motion to approve those folks for their terms.
I second or?
I move.
Yeah, we move.
She seconds.
And then I second.
All right, I'm spacing this.
Sorry.
This is a voice vote or a roll call?
Aye.
This, voice vote.
Voice vote, all right. All right, all in favors of approving the recommendations from the council committee on advisory appointments, say aye. Aye. Opposed, abstentions?
I move to
The
adjourn.
recommendations are adopted unanimously. Wait, I got to go through more things here.
God.
Items removed from consent, we had none. Council communications. Council Brooks.
I just want to say I was over at the Tualatin River Keepers Earth Day celebration right in our community. I got free trees from Tiger and their new climate action program manager, so it was nice to meet them. And there were other really great things there, other people that were telling us about bees and about the fishing and mussels and all the kind of things. So they did a great job, and there was a lot of people that came out. Thanks.
Council Hillier.
I again move to adjourn.
Second.
I have a motion and a second to adjourn. All those in favor say aye. Aye. Opposed? It's unanimous. Good evening.
Happy birthday, Bates.
Happy birthday, Bates.